This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly.
Okay, thank you and good morning, members, and I now declare this meeting open to the public online. Can I welcome all of our members who are participating by video conferencing this morning, and also to remind members about the protocols regarding the use of electronic devices. So there have been no apologies received for this morning's meeting. Are members aware of any other apologies? No, thank you. Moving on then, members, to chairperson's business. So a number of us met this week with the mother and baby Magdalene Laundry, an informal meeting with survivors, families and victims of that inquiry. I think it was fair to say that it was a very, very harrowing but a very valuable meeting, in the sense that we were able to hear firsthand the impact that this disgraceful period and disgraceful way of running institutions impacted upon people, and the continuing impacts that has on their lives. I'd like to very much thank those who shared those harrowing experiences, and I applaud their resolve in seeking justice and ensuring that others wouldn't have to go through what they have experienced. So any members at the meeting wish to comment in relation to that particular meeting?
Chair.
Go ahead, Paula.
Thank you, Chair.
Yes, Paula.
And thank you for facilitating the meeting. I think that it was really, really worthwhile to hear the first-hand testimonies of the victims and survivors, and I think it gives us all a bit of a spur on to really continue to engage with them going forward, because it was very clear from what I heard that they are, by and large, all moving in the same direction for a full statutory public inquiry. And I think, given the complexities of the issues that they raised, that I think I would be supportive of that decision at this stage.
Yeah. And I just would point out to members that we are due to be briefed by the department on that issue on the 11th of March. So this is clearly an issue that we will continue to have discussions on, both with those involved in the inquiries that are ongoing, and also those victims, survivors and family members who've been impacted by that. So thank you for that, members. Moving on then to the draft minutes. I refer you there, members, to the draft minutes of the meeting of the 4th of February at tab 3.1. So we're going back to these meetings because these were not agreed in last week's meeting, as Mr Chambers raised an issue in relation to procedures. The clerk has confirmed that the procedure was correct and in order. Members were emailed out the details of that yesterday. I would encourage members that if they have any queries on process and procedures, that they discuss it with the clerk at an early stage to address those. So are members content with the minutes?
Content, Chair.
Okay, members, thank you. Can I also refer members to the draft minutes of the meeting of 11th of February at tab 3.2? That's our meeting from last week, as normal. Are members content with those minutes?
Content?
Yes, thank you, members. So, members, there are no matters arising today. So, we can now then, I hope, proceed to our first substantive briefing session this morning, which is part of our COVID-19 disease response. And this morning we're receiving a Department of Health briefing on vulnerable children. Item 5 is the members will remember we received this consultation document in September last year. I refer you all there to papers at tab 5 of your pack. These include the department's original briefing paper and consultation document, and a copy of the Children's Law Centre's response to that consultation. Members will be aware that the Committee for Education considered this matter on the 18th of November. A copy of the official report of the meeting and subsequent correspondence are included at tab 5.4 and 5.5 of the pack. A copy of the official speaking notes for today's briefing is at tab 5.1 of table papers, and I'd also like to draw members' attention to relevant correspondence at tab 10.12 of your pack. So I would now like to welcome to our meeting this morning Ms. Eilish McDaniel, who is Director of Childcare and Family Policy in the Department of Health. Good morning, Eilish. Are you able to hear us there?
I can, Chair. Good morning.
And just check with Clerk. Clerk, do we have Eilish online or do we need to? No, good morning, Eilish. Yes, so I'm hearing you there. Okay, Eilish, thank you. We are also joined by Mr. Mark Lee, who is Director of Mental Health, Disability and Older People within the Department of Health. Good morning, Mark.
Good morning, Chair.
Thank you, Mark. Mr. Ricky Irwin, Director, Inclusion and Wellbeing in the Department of Education. Good morning, Ricky.
Sorry,
not hearing from Ricky. There's...
If you could bring Rathgill up.
Yeah,
good morning. Can you hear me now?
Yes, is that Ricky?
Yes, that's me.
Thank you. We're seeing Rathgill there. Good morning, Ricky. We're also joined, I think, by Mr. Maurice Leeson, who from Children's Services Planning Professional Health and Social Care Board. Good morning, Maurice. Okay, we're going to contact Broadcasting just to check on Maurice's connection, and Miss Geraldine Miss Geraldine Tague, who is Lead Allied Health Professions Consultant within the Public Health Agency. Good morning, Geraldine.
Chair, I don't think we have Geraldine on the call at the minute.
Okay, well listen, we are very well represented, I think, in order to make a start. Could I just remind all members of our panel, if you could please use a headset if possible. Try to ensure that your email is turned off. We know you're all very busy people with constantly pinging email inboxes, which can sometimes be heard. And if you just be conscious of the connections, and we have quite a complicated setup this morning in terms of how many different places we're coming from. So if I could ask the panel members to try to identify who will answer the substantive question that members may have, and then if there's any subsequent or additional information that anyone wants to include, if they can indicate to me, I'll bring you in on that as well. But if we could seek to have a substantive answer from one person, that's usually easier. And just to ask you all, if you have access to a headset, that is also something that's easier. So I think while broadcasting are going ahead there, maybe Eilish, I could go back to you and see, are you doing the substantive briefing, or is there could you outline for us how you want to manage that before we move to question and answer session?
Okay, Chair, so I will do the opening remarks, and then subject to questions that members have, other members of the panel will come in to answer those questions, and we know who will deal with what, because we've each got our own area of policy responsibility. So do you want me to start then, Chair, with the opening remarks?
Yes, please, go ahead. You're all very welcome. I should have said as well, you're all very, very welcome to our meeting. We appreciate your attendance here. And please, yes, Eilish, do go ahead.
Okay, so I just want to thank you, Chair, and I want to thank members of the committee for the opportunity to brief you on the COVID-19 Vulnerable Children and Young People Plan. We want to explain why it was developed and to provide some information on the outcome of consultation on the plan. At the outset of the pandemic, a decision was made to collect data relating to children who come to the attention of Children's Social Services on a weekly basis. Our initial concerns were triggered when the number of referrals to Children's Social Services fell in the earliest days of the pandemic. By week commencing the 6th of April 2020, a weekly average of 646 referrals had fallen to 542. And in discussions with officials in other parts of the UK, we knew that it was a trend that was repeated in all 4 jurisdictions. That raised questions about the potential for harm to some children and young people who were no longer visible as a result of lockdown, and was one of the key reasons why we sought to get vulnerable children into schools. However, the trend reversed rapidly. By the 11th of May, the 3-week rolling average for numbers of referrals was consistently in excess of the average number of referrals received weekly before the pandemic. And this is a trend which was repeated during the circuit breaker, a fall in numbers followed by a spike, and it's now being repeated during the current period of lockdown, making access to school as important as it was back in March or April last year. We moved quite quickly to work with the Department of Education to try to get children known to social services into school, including looked after children. Health and Social Care Trusts also saw places for some children in childcare, including children who do not in normal circumstances attend childcare, and that wasn't without challenge. The overriding public health message at that stage was to stay at home, and many parents and carers were fearful to allow their children to leave the home as a consequence. Arrangements were also agreed with the police at a very early stage to closely monitor families where domestic violence was known to be an issue. The joint working arrangements between health and education extended to supporting children with special educational needs during lockdown and in preparation for the return to school at the end of August 2020. And I'll say more about those joint working arrangements later. However, uncertain about how long the pandemic would last, conscious of the efforts by a number of departments and agencies to support and protect vulnerable children and families, and knowing that we needed a more coordinated cross-departmental interagency effort, we sought to pull those efforts together in the form of a Vulnerable Children and Young People's Plan. The plan was developed jointly between the Departments of Health, Education, Justice, Communities and the Economy. The stated aim of the plan is to promote the safety and well-being of children and young people during the COVID-19 pandemic, both within the home environment and within the wider community. It also aims to strengthen system capacity, not only to respond to current challenges and risks, but also to make preparations for the future rebuilding of services, alongside responding to further pandemic surges and associated restrictions as necessary. The plan recognises that there are risks facing children and young people in and outside of the home. It also recognises the pressures on children's services caused by the absence of staff personally impacted by the virus and the need to deliver services in keeping with public health advice. On the definition of vulnerable child, we cast the net widely. It's intended to include children and young people who were receiving support before the pandemic, as well as those who are experiencing increased pressure as a direct result of the pandemic. It includes children known to Children's Social Services, including children on the Child Protection Register, in care, on the edge of care, care leavers, and children placed for adoption. It extends to children in receipt of child and adolescent mental health services, those who have a statement of special educational needs, are accessing EOTIS provision or education nurture units. It also includes children not known to a statutory or voluntary and community support service, but who are vulnerable because of their families under increased pressure due to COVID-19 related circumstances. Asylum seeking and refugee children and children whose parents have no recourse to public funds are also captured by the definition. The plan reflects how services have adapted and enhanced provision to continue to support children and families during COVID-19, as well as new actions that have been undertaken specifically to address some of the risks and challenges. A key element of the plan is ensuring that children and families know how to access supports, particularly those that weren't available in the usual way. And this includes promotion of helplines such as the NSPCC helpline and the Domestic and Sexual Abuse helpline, which were both advertised across TV, radio and social media early in the pandemic. It also involves signposting families to sources of help, for example, through the family support hubs and through the COVID-19 community helpline. The plan also includes direct supports which have been provided to families, for example, the provision of digital services to support home learning, additional funding to support families where there's domestic violence, and support for those who need to access food through additional investment in fror, which is a national network of food distributors. In terms of capacity building, this includes putting in place protective measures to allow staff to deliver key services to families safely, measures to ensure adequate staffing levels are maintained, and delivering services in different and innovative ways. The more frequent data collection ensures we have the most up-to-date information on which to base decisions and continue to issue guidance in response to changing circumstances. We also ensured the plan included specific actions focused on the mental health needs of children and young people. And this recognises that the pandemic has further exacerbated our poor rates of mental health, including within the children's population. Aligned to the Department's COVID mental health response plan published in May 2020, actions including adjusting CAM's delivery models to address immediate priorities and to maintain a level of continuity, as well as development of a range of resource material for children and young people to help manage mental health during COVID-19. The plan was approved by the Executive and issued on the 18th of September for an 8-week consultation. We received 50 responses from a wide range of organisations, including the voluntary community and faith organisations, statutory organisations, local government, professional bodies, political parties, and one of our universities. The responses have been analysed by the Department of Health on behalf of the other departments. Many respondents welcomed the plan and the actions in it. The majority of those who responded to the questionnaire agreed with the definition of vulnerable children and young people, with the objectives of the plan and the actions in the plan. Respondents identified areas where they felt more could be done. Around 50% of those who responded had concerns that there are needs not being addressed. These included concerns about provision for children with complex needs, including a disability, autism and special educational needs. A number referenced how the loss of routines and support had led to an increase in challenging behaviour. The responses also reflected concerns that children would be disadvantaged educationally in homes where parents are not equipped to support home learning, for example, those with lower literacy or numeracy levels, parents who don't speak English, or because of limited access to a digital device or adequate internet provision. Financial hardship and concerns around the number of families in poverty or being pushed into poverty by the pandemic for the first time were also highlighted. Respondents also referenced the isolation being experienced by vulnerable children and young people and their families. There were comments as well in relation to harm as a result of increased time online, concerns about gaming addictions, the impact of increased online time on children and young people's mental health, as well as the risks of sexual exploitation. The consultation responses and an analysis of the findings have been shared with other departments so that they can apply the learning to ongoing planning and delivering for vulnerable children and young people during this lockdown and into the future. Under the plan, joint working by departments has been facilitated, in particular between the Departments of Health and Education, and that's why Ricky has joined us here today. One example of this has been the development of the Vulnerable Children Contingency Framework, which has been put in place by both departments, the Health and Social Care Board, the Public Health Agency, and the Education Authority. The framework builds on cross-departmental and agency planning for vulnerable children put in place early in the pandemic and is the direct response to calls for a single COVID-19 multidisciplinary vulnerable children process and feedback from the consultation and other sources on the impact of the pandemic and lockdown had on vulnerable children and their families. For some of our most vulnerable children, the protective factor of routine attendance at school, along with continued access to health and other supports, provides a vital public service which helps keep children vulnerable and their families safe and promotes their well-being. The framework aims to ensure that effective education and associated health and social care supports are in place for vulnerable children and young people in circumstances where COVID-related restrictions impact on access to schools. The definition of vulnerable child or young person is drawn from the COVID-19 Vulnerable Children and Young People's Plan. At the end of December, the executive decided to move to remote learning for all mainstream education providers, including preschool education settings and primary and post-primary schools. Schools, including special schools, are open for vulnerable children and key workers only. The contingency framework has been engaged since January of this year. The framework guides how vulnerable children are identified and supported in partnership with parents and carers and children, both in school or at home, depending on the level of the restriction on school provision. Schools are advised to work with education and health and social care partners to identify vulnerable children, using information already available to them through schools' pastoral care systems and their knowledge of children and families. It is supported by weekly oversight meetings attended by health and education officials from the Departments of Health and Education, the Education Authority, the Public Health Agency and the Health and Social Care Board. Throughout the pandemic, the Department of Education, the Department of Health, the EA, the PHA and Health and Social Care staff have continued to work with special schools, with the Special Schools Strategic Leadership Group to put in place additional measures to ensure that they are supported. The frequency of meetings was increased with the scale of the challenge at the time. Ministers have now agreed that staff in special schools who are supporting children with the most complex healthcare needs will be offered the COVID-19 vaccine. And while we know that children generally are not at increased risk, these are some of the most vulnerable young people. And by vaccinating the special school staff, we're protecting those children who may be at a higher risk in health terms if exposed to COVID-19. Both departments have also agreed and announced a PHA proposal to commence weekly asymptomatic testing for special school staff and pupils. Testing, which will commence this month, will contribute to reducing the rate of infections in special schools, as regular testing will identify cases either before they're symptomatic or asymptomatic in cases, allowing immediate self-isolation, thereby potentially reducing wider transmission, both within the school and in the contact groups of pupils and staff. The planning process enabled us to identify and articulate the risks and challenges experienced by children and families during the pandemic, to identify what departments were doing in response to those risks and challenges, to identify gaps in provision, and to promote new responses. This pandemic has prompted, in some cases out of necessity, services to be delivered in innovative and new ways. It's important that we capture the lessons learned, both good and bad, from this experience, and recognise and react to the scale of the challenge for young children and young people and their families. This was an emergency plan, Chair, developed in response to a public health emergency. It was not intended to be, nor is it a substitute for longer term planning under existing strategies, including the Children and Young People strategy and associated strategies for vulnerable groups of children and young people and or their families. Members should note that the Children and Young People strategy has now identified the impact of the pandemic as one of the areas of greatest focus going forward. It had already identified many of the children who fall within the definition of vulnerable child under the COVID-19 Vulnerable Children Plan as children whose needs require specific attention. For many of those children, their needs have been exacerbated by the pandemic, meaning that departments will need to work together in the future, potentially redoubling their efforts to ensure that those needs are met. The key priority areas identified by the Children and Young People Strategic Partnership, which it will take forward over the next planning period, likewise align with key themes of concern coming through the Vulnerable Children Planning process and from local and wider research on the impact of the pandemic. They are children's mental health and emotional well-being, early intervention support for children with disabilities and their families, support to children whose well-being is being affected by disruption to their schooling, contribution to strategic cross-departmental actions in response to food and fuel poverty, as well as locality-based service responses. Members of the partnership, which will include all of the key children's organisations across a range of sectors, will prioritise these issues of shared concern, and they have committed to seek opportunities to work together to coordinate activity to address those concerns. And they will also share best practice and share learning. Thank you, Chair, and we're happy to take questions from members at this point.
Okay, Thank you, Eilish. Appreciate that. And before we go into questions, I do want to declare my own interest in relation to my previous role as a social worker and working indeed within family and childcare, and also that I continue to be on a career break with one of our trusts. So I also wanted, before I start, just to, I suppose, reflect the very grave concern of teachers and school staff around all of these issues as well, and they are acutely conscious of that. But I also want to commend the efforts that I know from speaking to teachers here locally, the efforts they have gone to try to fill that gap, to try to keep an eye on children that they think may need extra support. And they have managed that through very, very difficult times, I think, to the very best of their ability. So I just would like to acknowledge that as well. So, Eilish, first of all, now, there has been a substantial and a very, very detailed and thorough response from the Children's Law Centre. I want to acknowledge that. One of the issues that they raise is the definition that's used. And they pointed out that it excludes children who need a social worker, but as a result of ongoing delays, haven't been allocated one. Do you recognise that as an issue, Eilish?
Okay, so the definition included children already known to services, but it also included children who are not known to services. And that was intended to be a catch-all, and it was a recognition that the pandemic was probably going to impact on families previously who had not come to the attention of services before. So I know what the Children's Law Centre has said. I think the definition is as extensive as it needs to be. I think the issue with families that are not known to services is if they're experiencing difficulties, ensuring that they can access help. And one of the things that we did over the pandemic, and we've repeated it several times now, was to raise public awareness of some of the challenges being experienced by children and families, and advising them to be vigilant, and recommending that they make contact with services if they've got concerns about any child or family that might be in need.
Okay, and why would it not appear to be a very logical approach to use, as the CLT have pointed out, Article 17 of the Children Order, to ensure that you have those children who are in hospital, children who are in poverty? Why have you decided not to use that definition?
So the definition does include children in need, and that is a reference to children in need within the meaning of Article 17, Chair. So, and I think we have engaged in a discussion with CLC on that point. So I think it's wrong to suggest that the definition of children in need within the legislation isn't covered by the definition. It absolutely is.
Okay. Moving on then to the equality impact assessment, and I do note that you've said that this is an emergency plan. In light of the fact that it is an emergency plan, does that not indicate that broader and wider and deeper consultation is needed and is actually possible as well? Because we do have, all Zoom access to Zoom meetings. We have people. You would think that the people who are engaged in that work would be still able to find other ways to ensure that equality impact assessment is going on. Now, Children's Law Centre do make some quite telling remarks and concerning remarks, I have to say. They have stated that a full equality impact assessment, they should have been screened and a full equality impact assessment carried out, that the departments have failed in their duty to consult with all stakeholders, and in doing so have deprived themselves of the opportunity to be fully informed. And I think that's a key point in that for me, consultation is always an opportunity to take first-hand experience from people on the ground. And the net impact of that, worryingly, is that they say that acting on partial information, the departments may in fact have exacerbated inequalities for some of the most vulnerable children by diverting resources away from them. So what's your comments on that, Eilish? Please.
Okay, so we didn't undertake either a screening exercise or an equality impact assessment when we initially put the plan together. And I think I've made the point that we were required to act quickly here. And I think what we did mirrored what was done in other parts of the UK too. I mean, that was the purpose of consultation eventually, which was undertaken, granted later in the year. I mean, we did want to see whether we had actually pitched the plan correctly, and whether we were covering all of the risks and challenges faced by children and families, and whether there was anything more that we needed to do. I mean, I think it's wrong to suggest that we weren't using information available to us in the construction of the plan. So we did work closely in the very earliest days with organisations like NSPCC, with Bernardo's, engaged with family support hubs to get a sense of the issues being faced by families in those very earliest of days. I mean, one of the things that we did quite quickly too, Children in Northern Ireland undertook a parenting survey. I think that ran between May and June, and very quickly we had Children in Northern Ireland on a Zoom call, as you suggested, Chair, with senior officials from all of the relevant departments attending, so that they could be made aware of the key messages coming out of that parenting survey. So hands up, Chair, we didn't undertake a full screening and exercise or equality impact assessment, but I think it's wrong to suggest that we were acting without access to evidence available to us.
Well, I appreciate that, and that's absolutely as we would expect. However, given that we are now a year into this pandemic, and given that all departments have indicated that they will learn and implement learning, you would expect that the very important issue of equality screening would now be addressed more fully. Actually, I think it's more important. I don't think it's something that in the current circumstances, I think it needs to be done more rather than less. So I think that's an issue, and I do notice that is noted in relation to all departments. It's not just health, but I think it's crucial that equality impact assessments now do happen and actually are improved and increased rather than lessened in any respect. So thanks, Eilish, for that. Anyway, I will now go to members, and I'm going to go the order I have at this point in time. I'm going to Paula Bradshaw, then Orlia Flynn, Pam Cameron, Karen Killen, and Jonathan Buckley. So Paula, please go ahead.
Good morning, panel. Thank you very much for coming this morning. The first question relates to the consultation process that you undertook last year, and I'm just wondering if the issue of equal protection came up during that as a legislative change. Equal protection is really the campaign from NSPCC to remove the defence of reasonable chastisement from the law. Thank you. That's the first question.
Paula, I would need to check the consultation response in more detail. From memory, I don't think it came up as an issue, but I would prefer to actually check the responses and the report to make absolutely certain that I'm advising you correctly.
Okay, thank you. The second issue is also around about putting things into statutory footing, and I suppose a lot of the services that have been developed and, as you say, maybe adapted and continued. Is there any plans to put some of this stuff in almost like a legal obligation that these support services are in place for the children and young people, so that going forward, they can have a certain guaranteed a certain level of protection under the law? Thank you.
Okay, so statutory duties already exist. So the Chair has already made reference to the Children Order and requirements under the Children Order relating to children in need, for example. So there are requirements under the Children Order to provide services to children and families in need. Obviously, statutory duties within the Order too relating to the protection of children and to look after children. Some of those duties, I think, already exist. That we're bringing forward an Adoption and Children Bill, which will strengthen, I think, some of the protections available for some of the most vulnerable children, including, for example, children who have left care by extending provision to them for longer periods, etc. In short, I think the duties that you're asking for, I think, exist already in current legislation, and through the Adoption and Children Bill, I think there is a potential to strengthen some of that.
Okay, thank you. I think you meant in terms of the sort of heightened, the sort of more robust support services that they could be privy to or could access or be provided with. But just then, finally, then, have we got a timeline then for when the Adoption and Children's Bill will come before this committee for scrutiny?
Okay, Paula, so the intention is to introduce by the end of March, hopefully have a first reading completed by the end of March. That's in the plan at the minute, and all of the indications at the minute are that we will be able to do that. If that's the case, then scrutiny by the committee will happen after Easter.
Okay, thank you very much. Thank you, Chair.
Okay, thank you. And so, members, we will use our normal type of system in terms of allocating out time roughly. So it's around about 8 or 9 minutes in total that members will have. So I'll allow members to kind of manage that themselves. And I'll go then to Orlia Flynn.
Thank you, Chair. Thanks, Eilish. So I just wanted to touch on within the plan itself. One of the things that I've been wondering about, so one of the action point, it's actually the first action point around how you can, maximise the opportunities to get vulnerable children out of their home and into a more safe environment, and obviously the issue around getting them into school. And you have listed so the different professionals who can do that identification to get kids back into school if they need time in a safer environment. And you've referenced obviously social workers, teachers, school nurses and youth workers. I'm just wondering practically, how is that going to work? So if there's children that is it down to the teacher, is it down to the PSNA, is it down to the youth worker? Who is actually taking on the sole responsibility to reach out to that family or legal guardian to ensure that child can access their school environment, because it seems unclear because there's so many different professionals mentioned. So is there one focus on how you're reaching out to those vulnerable kids, and have you assessed the figures currently? So within the past year, do you have the figures of how many vulnerable children have taken up that option? And can you give the guarantee that all those families have been reached out to, so they know that option is available? Because some of the feedback that I've been getting from different families, I'm not sure if that's been the case and if they're aware of it.
Oh, okay, Orlia, thanks very much for your question. And that's exactly the purpose of the contingency framework that I have referred to. So this is the joint framework put in place between health and education. The purpose of that framework is to enable children, vulnerable children, to get into school in circumstances where restrictions apply. The plan or the framework deals with identification. So and it indicates that primary responsibility rests with the school, and I've addressed that in my opening remarks. I mean, the school know children best through their pastoral care systems, etc. And we have communicated with Health and Social Care Trusts also, the department has, making it clear that trusts need to engage fully with that framework. So that would require social workers to work with schools to ensure that vulnerable children known to them are enabled to go to school. And it would also require other health professionals, again, to work with schools to provide very vulnerable children with some of the support, the health and social care supports that they actually require. I mean, I'm going to hand over to Ricky at this point, because Ricky should be able to provide you with some of the data that you've asked for, the numbers. But I can say that the position in the third wave is considerably different from it was in the first wave. We've got a considerable greater number of children in schools, but Ricky can fill you in with the detail. Earlier, Ricky, do you want to take that, please?
Yes, thanks, Alice. So certainly we've seen a much more positive position in terms of school attendance since the beginning of term, and certainly in terms of vulnerable children and young people attendance. So Alice is right, the schools would have primarily the responsibility of reaching out to those children which it deems to be vulnerable and it knows to be vulnerable as well. In terms of how they're accessing learning, and the framework really is supposed to encourage what's in the best interest of that child, and if for that child that means encouraging attendance in the school, then that's what the school will do. But the school's not alone in that. The school will work closely with the Education Authority services. There are various pupil support services who have individual caseloads of vulnerable children, and I'm thinking about the Child Protection Service, the Education Welfare Service, children who are looked after, children who attend nurture groups, and so on. So the EA has been reaching out to those families and those children, and the youth service as well, of course, and just to really make those connections, encourage school attendance, and where school attendance is not achieved, to make sure that there's some form of learning in place, and that other supports around health and well-being and so on are made available to those families. In terms of numbers, I think during the first wave, we did set up a survey process with the schools which were operating at that time, and we asked them to report to us on a regular basis in terms of those that they thought were vulnerable who were in attendance at school. It was fair to say that number was quite low early on, in the hundreds. Now we're into the thousands. We're into 2,000 or 3,000 in terms of vulnerable children attendance at school, and that would be separate to children who attend special schools. Special schools, of course, have been open since the beginning of term. All the children who attend special schools would be vulnerable according to the definition because they have a statement of special educational need. Attendance at special schools since the beginning of term has been in and around 50%, so that's around 3,000 children there as well. So the figures are a lot healthier. I don't have the exact figures from this week with me. I wasn't able to get them before I came here this morning, but I could certainly follow up with those to the committee if you wanted me to.
Yeah, no, that's really helpful. Rick, thanks very much, and Eilish. And because I'm just wondering, I suppose, the concern that I would have, and I know that the special schools, that they probably have had more structure in the sense that they have remained, opened for those vulnerable kids, but it's more so maybe the vulnerable kids who also have special educational needs and statements, but who are in the mainstream schools. But that's good to know then. So I'm assuming that it's the mainstream schools report back to yourselves. Is that right? To make sure that they are following up on that process for any of their vulnerable children within the mainstream. Is that right?
So what we have is a system where schools obviously have a management, a SIMS, it's called. It's a computer system where they would record attendance on a daily basis. So we get the results of that. We then also have a weekly survey where we ask the schools to identify the numbers of vulnerable children who are in school and also who are not in school. So we get the results of that as well. And then we get a weekly report from the Education Authority, which is quite a wide-ranging report that goes across maybe 10 to 12 different EA services. And they give us detail on the number of children and families that they're dealing with, the level of contact that they have, and also where they have to escalate, where they have some concerns and what they've done around that. So there's quite a lot of data that we get on a regular basis. So we are in touch with the system, the school system, on a regular basis. We're not, I wouldn't be in touch with 1,100 schools on a weekly basis because it just physically wouldn't be possible. But certainly the EA has a range of support officers in place. They're cross-organisational link officers. They're called COLOs. They are supporting the schools through the pandemic. The special schools then have an additional layer of dedicated support officers from within the EA who are supporting them because of their special and individual circumstances. So there's quite a strong network of support in place, and we are monitoring the situation as we go through each week.
Okay, thank you. And hopefully the contingency framework, Eilish, as you had outlined, and with this plan, that'll obviously help those numbers again to increase. Just finally, a very quick small point to go back to one of the issues that the Chair raised around the Children's Law Centre flagging up concerns around the remit of what a vulnerable child is. And I know Colin had mentioned around children who have who are actually awaiting to be assigned a social worker. So do we have, and obviously they don't fall under that definition currently. Are you aware of how many children would be in that situation where they've been identified as being possibly at risk? They're awaiting to have a social worker assigned to them, but they mightn't be picked up within this plan then. Do you have a figure on how many kids that could be impacting on?
Okay, so earlier we do actually collect information on what we call unallocated cases, and the first thing that I want to assure you of that there will never be a case unallocated to a social worker where there are child protection concerns. That will absolutely not happen at all. I think we started the year with a relatively high number of unallocated cases. In March of last year, it was around 800. That fell consistently through to August of last year. And unfortunately, it has been on the rise again since that. So the latest figure that I have before me here is 711 unallocated cases on the 30th of November 2020. One thing that I do want to add is that this has been recognised by the department as a particular problem, and it was one of the reasons why we have made an additional investment in our family intervention team. So around 4.6 million has been allocated last year to those teams, and that's to enable additional social workers to be employed within those teams. So around 10 band 7s in each of the 5 trusts. We're also putting in social work assistant support, so that social workers aren't engaging in some of the bureaucratic work that sometimes they have to become involved in, and we've also put recruitment support in place. So we do recognise that it's a problem. I want to assure you that no child about whom there are child protection needs will not be allocated a social worker, and we have made investment to try and address the problem.
That's great, thank you.
Okay, thank you, Orlia, and going then to Pam Cameron. Go ahead, Pam.
Thank you, Chair, and thank you, Eilish and panel, for your attendance at Health Committee this morning. It's obviously it's a very worrying topic, dealing with vulnerable children, but I do welcome that this emergency plan is a cross-departmental piece of work. I wanted to ask in around, you referred to vulnerable children being known to be at risk in terms of domestic violence in the home, and we understand that, but we also recognise that some children will only have become vulnerable as a result of direct pressures on families resulting from COVID-19. Can you outline how the action plan is addressing those children without prior contact with services, making them visible, and perhaps outline how the 29 family support hubs are meeting the needs of these young people? That's my first one, thank you.
Okay, so I'm going to hand over to Mark at this point. Mark leads on domestic violence policy, and I might come in with some additional information about some of the activities that have been going on and within individual trust areas. Mark?
Sure. So obviously the evidence from across the world has seen rates of domestic violence increase during the lockdown periods, and as a result, we've looked to provide additional funding to some of those agencies that work to support people experiencing domestic violence. So there was, I think it was around 60,000 provided to Women's Aid for some of their work supporting children and young people. In addition, we provided some additional funding to the domestic violence helpline to ensure that they could deal with increased calls to some extent, but also they could continue to operate even with the requirements for social distancing and the like. And more recently, there's been some funding signed off for the Men's Advisory project to provide psychological counselling for male victims of domestic violence. We've also picked up a Home Office-led domestic abuse code word scheme here, working through pharmacies, so that participating pharmacies, which includes Boots, chemists, there are around 95 of these pharmacies in Northern Ireland. Individuals can walk in and ask for Annie, and that will be a recognised code word where they will be taken somewhere private and signposted onto appropriate services to support them where they're experiencing domestic violence. So those are some of the initial initiatives that have been taken. There's also PS and I have been kind of leading cross-cutting work to look at the impact of increased domestic violence and how we respond to that and make sure we continue to maintain kind of awareness across society of the need to look out for domestic violence, to respond to it, and not to look away when there are concerns that it's happening. So that's a range of the kind of additional actions that have taken place to respond to some of the domestic violence pressures during the lockdown period.
Pam, I can add to that, just to say some of what has been going on within some trust areas. So within the South Eastern Trust and the Southern Trust, they have run a number of social media campaigns, working jointly with local councils and with the policing and community safety partnerships. It's been done a number of times over the last year, including over Christmas, and I think that has worked quite well. The Southern Trust, again, has worked with a number of local partners, and the purpose of that is to try and prevent issues getting out of hand or escalating. So the Trust has advised that it has worked with around 177 families up until December of this year, all for the purpose of preventing domestic violence becoming a particular issue within the family.
Okay, and thank you both for that commentary around that, and obviously I'm glad to hear that of the funding to the likes of Women's Aid and to MAP in terms of domestic violence, but I think it's really important to remember that domestic violence very much affects children, and the witnessing of it and the long-term impacts are huge, and we know Women's Aid have very good programmes in working with children, and I imagine there will be a huge fallout from this, and there will be more funding required in order to support them, to support the children who have been affected, especially during this pandemic in particular. But my second question is around the action plan. I want to know how the action plan seeks out the vulnerable children who we would normally expect to be subject of in-need referrals, and what is the lasting impact of the 30% reduction of referrals since December?
Okay, so the plan includes within the definition of a vulnerable child, children who would be reported to social services. So if they are if a referral is made to social services, then PAM under this plan, they will be provided with services deemed to be necessary to meet whatever needs are present within the families. The family support hubs can also assist with this also. So, you know, that we've got 29 hubs operating across Northern Ireland, and those hubs have continued to provide services throughout the pandemic, and you know, some online services provided to families too through the Children and Young People's strategic partnership. So I just want to assure you that we are working with those families in need, and the referral numbers have consistently gone up, Pam, throughout the pandemic. From we started to collect data, the numbers of referrals dropped initially, but have continued to increase over the course of the pandemic. Slightly different position with child protection and referrals. They have risen and dipped when schools closed, for example. But the numbers of referrals relating to children in need have consistently been growing over the period. But I just want to assure you that you know, trusts are picking up those referrals and providing services to those families, or referring families to other services as necessary.
Okay, that's very useful. Thank you very much. I suppose that really just does highlight the need to for us to get the kids back to school as soon as physically possible, not just for their you know, for their educational welfare, but for their physical and mental welfare as well. But thank you for those answers.
Thank you, Pam. And I'm going then to Carol Nicullen. Go ahead, Carol, please.
Thank you for your presentation. I just want to ask a couple of questions. So first of all, I do believe we need to have, I appreciate the difficulty we're in, but we definitely need to have a full equality impact assessment, and that's the Department of Health, rather than screening this stuff out. There are clear differences and there are clear inequalities, particularly felt by children, but really vulnerable children. So that's a comment. The other issue I want to ask is that the Children's Law Centre said in their presentation, they raised the issue of chemical constraint or restraints, which is very concerning. So I would just like your views on that. You will appreciate, and it's mentioned throughout your presentation, that many within the community and voluntary sector, again, I had the privilege of attending VoiPIC roundtable yesterday, and this come up constantly, that without the community and voluntary sector working collectively with the trusts and other partners, that these children would have been further discriminated against or isolated. So I suppose my concern is the trust are now going from grants to tenders. And if smaller groups within the community and voluntary sector don't have the means for example, the big indemnities that are required, they're going to disappear, or they're not going to bother applying and will disappear as a result. And they do some of the most outreach and support to some of our most vulnerable children. So I'd like your views on that. And then my last question is really around a COVID recovery plan. I mean, it was very clear from VoiPIC yesterday that those children who are coming out of care looked after actually experienced more isolation, poor mental health, and got moved around and didn't get the support that they felt they needed. It was hit and miss, and that's not something any of us want. So just like some of your comments, and Chair, just before I finish, I think it would be appropriate to have the Children's Law Centre to come to the committee as well to present. So that's my lot. Thank you.
Thank you, Carol.
Mark, can you take a question about chemical restraint first of all, please?
Yeah, absolutely happy to say something on all of those points if you want, Eilish, but starting with the chemical restraint points. So obviously prescribed medication is often a part of an overall care plan for some children, which will look at psychological, behavioural and environmental approaches. And it can be a very effective and important part of managing challenging behaviour and minimising risk to individual. Obviously, we'd expect any medication and use of medication to be in consultation with the young person and their parents, and taking account of their views. We are speaking to medical colleagues about how we can have a systematic look at the use of prescribing over the last period and see what impact there has been. But it is important to say, it's it would have been a part of the existing treatment regime for many of these people, or for many of the children that we're talking about here. And the context has obviously been a very challenging one with lockdowns and changes in routine, and that will have had an impact on those children, and a requirement to look at how we help them manage their behaviour. So medication should have been and will have been regularly reviewed, looking at side effects, the evidence of benefit, and the aim from the clinicians will always be to use the minimum dose possible for the shortest period possible. I guess that's the context for some of this, but just to reassure you, we are seeking to have a look and check the use of medication over the last period, see if there have been increases in the use of medication, and if so, just confirm that those are all justified and have been done in the right way. Because I think we are as concerned as you would be at any suggestion there may be overuse of medication as part of care plans. Do you want me to say something, Eilish, on BCS and maybe the mental health support as well, and then you can pick up anything additional to
Mark, just if I can, you're breaking up slightly there, so if you just take it slow, it's a wee bit, we're following you, but you are breaking up slightly. If there's anything you can do to improve that, go ahead, please.
Okay, I'll slow myself down, and please do ask me to repeat myself if you need me to. Just 2 points I've made around the voluntary and community sector, and would absolutely agree they've been an absolutely critical part of the response to the COVID-19 situation and to providing support to vulnerable young people. One of the things we have done is to, and we did this very early, was to say to Trust that you should continue to pay your contracts with the voluntary and community sector if they aren't delivering precisely in line with those contracts. We look to guarantee the income for the voluntary and community sector, even where, for instance, they had to change their ways of working or they weren't quite delivering the same outcomes. So that's one important thing we've done to recognise the value and importance of those relationships. The second point I would make is that I think the COVID-19 crisis has really driven a focus on partnership working between the Trust and the voluntary and community sector much more strongly than before, and certainly speaking to groups like ARC, who would represent a range of learning disability providers. I think there's a real appetite on the VCS side, on the Trust, to think how we can build on some of the really good practice that's been established in terms of that partnership working, and really embed that further. So we're going to be taking forward some work with the Health and Social Care Board to look at the learning around the way those partnerships have been strengthened, and to build on those relationships with the voluntary and community sector that must have. Then I think there was also a point around mental health and some of the support there being hit and miss, and it's obviously been challenging circumstances for CAMS, for instance, to provide support. They've looked to do that through changing their ways of working. They've put more support online for people. They've looked to do online and over the phone engagement. We've had specific pieces of work around the impact of COVID-19 on children and young people's mental health. We've taken action, or we took action, for instance, for a period to stop transitions to try and provide some stability to young people receiving mental health and support. And there's been a really important piece of work jointly with the Department for Education, which Ricky and his team have led on, around an emotional health and wellbeing framework for schools, which is really looking to boost the support that schools can provide to individuals suffering from poor mental health, to build the resilience of the school population as a whole, to really identify those early opportunities for intervention, to make sure schools are really confident in how they can support pupils, what services they can turn to. And I think we'll be hearing more from both the Education and the Health Minister on that framework and on funding for services associated with it, and new initiatives we'd like to take forward to provide additional support for young people's mental health and emotional wellbeing through schools.
Okay, Carla, if I can add then to Mark's input on the voluntary and community sector, and I agree fully that we rely very much on the support of the voluntary and community sector. So the family support hubs that I've referred to function purely on the basis of voluntary and community sector support. There are around 600 organisations associated with that hub network, and that's a measure of the extent to which voluntary and community sector organisations contribute to families who need some level of support. The department also core grants a number of voluntary sector organisations, Carol, around 67 of them. And we did a couple of things last year, recognising the difficulties or the challenges of the pandemic. So we simplified the application process. We give organisations the flexibility to direct some of their funding or some of their efforts towards COVID responses. And we delayed a decision, to make an open call for core grant applications for a further year. I'll also say that the Minister is currently considering how he might support those 67 organisations in the current financial year, but that decision hasn't finally been made yet. If I can turn then to your comments about children in care, Carol, I want to assure you that we've done everything possible to support children in care during the pandemic, and that's by way of additional funding support, for example, for foster carers, for children in residential care, and we have relied on the voluntary and community sector in those efforts also. So VOIPIC has very much been involved in providing advocacy and emotional support to some of those children and young people. Organisations like Fostering Network likewise have provided additional IT equipment to children in care to ensure that every child has access to IT equipment. So around 800 pieces of IT equipment have been provided by Fostering Network, and around 400 pieces of software also provided to children in care. So I quite obviously all of those children are being supported by their social workers also throughout the pandemic. I just want to assure you that we've done everything possible to ensure that they are fully supported. It has been a challenging time for them, and it has been a challenging time for social workers also, but we've done everything possible.
Thank you.
Sure. Could we could we also consider VOIPIC coming in with some of those children, because we're very powerful when I spoke yesterday. And just to say, I don't think anybody set out to exclude or isolate kids, but that's the impact. And that's why I definitely think we need a full EQIA on this whole process, this budgeting process. But thank you.
Thank you. So I'm going now to Jonathan Buckley, then I have Jerry Carroll, and then Alan Chambers indicating at present. So go ahead, Jonathan, please.
Thanks, Chair, and thanks to the panel for their detailed report. I suppose probably the report highlights what many of us have felt throughout COVID-19, that those that are most impacted by the subsequent restrictions have been our children and young people. It's clear, it's evident. I think we've all been saying that, whether we can look at those that are most able in our school settings, but also, as your briefing quite adequately highlights, especially those children from vulnerable and different backgrounds. I would say that probably we must focus, and I think this should focus minds in this report, to say that we need to get our children back to full-time education as quickly and as safely as possible. It's all too easy for politicians or others to suggest closing schools, but we need to look at the knock-on impacts, and quite clearly they're evident. I've been talking to teachers in my constituency, and the chair's outlined, and they have done a remarkable job to try and be innovative in the way in which they can reach out to children in very difficult circumstances. But there's been limitations, and it's limitations for those children that are at risk, because quite normally whenever children are in school, there's that physical examination by a teacher and observation to see if there's any worrying signs. I'm not sure I hear something. Sorry. If they see the worrying signs that a child perhaps is vulnerable, and therefore can report it into the system. But with the home learning element of it, there's been no ability, whether it's via even Zoom call or whether it's through this video format, to even have a brief observation of how the child is doing. And I was wondering if maybe somebody could give me an update as to, was there an attempt to try and use that sort of video technology that would enable teachers to be reassured as to the welfare of their pupils? That's one thing. I also noticed that I'd like to know, why hasn't the Department of Health used powers of direction or availed of emergency volunteer schemes to support vulnerable children in special schools during the pandemic? I'll leave it for the moment, Chair, but I have a couple more after I've heard back from that.
Thank you.
I think we've already made the point, and I think you're agreeing with us, Jonathan, of how important school is to children, not solely to support their learning, but also to provide some level of safety around them, and to also promote their welfare. And it's one of the reasons why we have consistently tried to get vulnerable children into school over the pandemic, and Ricky has reflected how more successful we have been during the third wave than we were during the first wave, and the numbers have continued to increase week on week. In terms of children being visible, yes, social workers have maintained contact with children for whom they are responsible, using a range of methods. Now, the preferred method is seeing children face to face, but if a risk assessment determines that that's not possible, then social workers will use technology to best effect to make that possible. So there have been examples of using Zoom calls, etc., using social media, using telephone technology, etc., just to maintain contact with children and young people who are vulnerable. But the preferred method is for social children face to face, and sometimes that's had to happen out of doors too, just simply to make that possible. Ricky, do you want to say anything else about special schools other than what we've already said?
Yeah, it's a good question. I think the special schools, because their situation has been different this term, the executive, in response to concerns from the first wave, decided that it would be important that special schools operated as much as normal from the beginning of this term, and that has been the case. Of course, some parents have decided anyway that they want to keep their children at home, and that is fine. But I think I referenced earlier, attendance has been in and around 50%, so it's around 3,000 pupils of the special school population. But there has been a significant effort in terms of additional funding and additional support that's been provided to the 39 special schools from the Department of Education and the Education Authority, to really support them in maintaining their services as best they can. It has been a challenging time for those special schools. I have to acknowledge that. There have been issues around shortages of staff, around fears over them being in school, fears over the virus and so on. So we have been working very closely with the strategic leadership group of the special schools themselves to work through any issues and provide any additional support that we can. So I think we're learning on that as the weeks go by. We have helpfully been able to put in place a testing regime, which was referred to at the beginning. We're moving forward now with a vaccination programme for staff who support the clinically extremely vulnerable children as well. So as we go through this, more and more support is being identified and provided, and we're keeping those lines of communication firmly open with the special schools to make sure we're doing everything we can.
Okay. Well, another, Dan, I appreciate your answers, but I suppose while I have noted and through your report how getting those vulnerable children into school throughout the waves has significantly improved, but I would stress that on speaking regularly with teachers, there is still children that they are worried about that aren't filtering into the school system, unfortunately, and it's becoming very alarming as to not only their welfare, but indeed further than that, in relation to their engagement even on the online resource element of it. But another devastating impact has been the impact on mental health, especially for our young people. Are there plans to enhance the child and adolescent mental health service budget as part of medium-term planning for increased demand? Because when we come out of this COVID-19 restriction period, I think we're only scratching the surface as to the serious issues that are going to face society in relation to mental health, and that is probably going to be even more acute with our young people.
Mark, will you take that? Yeah.
Yes, I'm going to say I'll pick that up. Can you hear me okay?
Yes, we're hearing you, Mark. We're hearing you okay. Thank you. Yeah.
Good. Okay, thank you. So in terms of additional resources for CAMS, there was an additional 750,000 provided this financial year, I believe, to recognise some of the pressures there. And as I mentioned earlier, I think there's something around the kind of core CAMS capacity, of which that 750,000 will provide some additional capacity. There's something around the most effective ways of working and joined up regional ways of working. So we've been developing a CAMS clinical care network, which is noted in the mental health action plan that was launched back in the kind of spring of last year. So that will look at how we kind of make best use of resources and do the most effective things with what we've got. I did also mention there as well the emotional and mental health wellbeing framework in schools, on which I think we'll hear more soon around some of the additional resources that both the Department of Health and the Department of Education will be putting into that, looking at how we support schools and how we support young people with their mental health, and as far as possible try and intervene early and provide support before maybe a formal referral to CAMS is needed. So some additional funding going in, new ways of working being looked at, this framework with education, which I think will be really important, and we'll continue to look closely at CAMS. I guess the other final point just to make is that the mental health strategy, which is currently out for consultation, is suggesting a commitment to increase the percentage of the mental health budget which goes to CAMS to bring it more into line with the kind of 10% average that we would expect to see where compared to some other comparable countries.
Okay, thank you. And just finally, in the briefing paper, the Minister suggests that parents and students have been engaged by the multidisciplinary panels focused on saying children. It stands in contrast to what the Children's Law Centre is saying. How is the input of parents being maximised in decisions that are taken?
Maurice, I don't know whether you're on the call. Do you want to say something about reference groups?
Yes, it's Maurice Leeson from the Health and Social Care Board. In response to the question around the input of parents for the regional health and education interface group that was referred to earlier, we have input each week from young people and input each week now from parents. So we're able to, we set up networks where we're able to talk to parents across Northern Ireland, young people across Northern Ireland, identify what their issues are, and then bring their issues into the discussions we're having at the regional group.
Thank you, Chair.
Okay, thank you. Going then to Jerry, then Alan, then Ciara. So Jerry, Ciara, go ahead, please.
Thanks, Chair. You can hear me okay, yeah?
Yep, hearing you there, Jerry. Thank you.
Just a bit of issue with the camera, but glad you can hear me okay. Thanks, panel, for that. A couple of questions. I mean, one observation, first of all, the fact that, as Ailey said, 50% of respondents, the consultation were not happy with the level of services being presented is very concerning. And I note the figure around the drop of referrals in April of this year, and I think Pam referred to December. But is there a total figure for the total level of referrals that have decreased as a percentage point from 2020 as compared with 2019? Because we can take a month here and there, but I think we need to have a fuller picture of the drop in referrals. And also, I know your answers to Orlia in regards to the education and the multidisciplinary vulnerable children panels. I got cut off in some of the presentations, so apologies if I missed it. But is there a strategy for when vulnerable children are going to return to school? Because obviously there's a strategy, or there's a process in place for vulnerable people who have to be in school now, but is there a strategy for when people who've been at home effectively for a year who are vulnerable, going back to school can obviously be very difficult and traumatic? So I may have missed it, but is there a strategy in place for that?
Okay, so can I take your question then about referral numbers? So the point that we've made is that the figure dropped at the start of the pandemic, and I think that's when schools closed and children were less visible at that stage. But I've also made the point that the number has consistently grown over the course of the pandemic. So if I can give you the figure for the week beginning the 8th of February, there were 755 children referred to social services in that week. And the pre-COVID average, weekly average, is 600, or was 646. So you can see that the number is quite a bit higher than it was pre-COVID, and it has stayed consistently high over the course of the pandemic. I've made the point about child protection referrals, that pattern not being quite the same. We've had a trend of there being a spike followed by a fall, followed by a spike, followed by a fall, and that in the main is related to schools closing. So when schools close, the numbers go down. When they reopen, the number goes back up again, and we're in that phase at the minute. I think the child protection referral numbers dropped to their lowest level around January, around the 11th of January of this year, although there has been some recovery over the course of the last couple of weeks too. But there's a direct correlation between schools closing and child protection and referrals being made. But the other referrals relating to children in need, they have consistently grown over the period of the pandemic.
Okay, and the question just about education, I don't know if that's Ailish or Ricky.
Yeah, I'll take that, Ailish. Jerry, yes, good question. I suppose the key point to begin with is, of course, that vulnerable children, according to the definition, have had access to school, throughout, and so that has been our objective, to get as many vulnerable children into school for supervised learning. But I think in terms of the broader planning for education restart, we're looking at that now within the department, There has been a programme called Engage, which provided funding to all the schools before Christmas to support lost learning. So we're looking at the lessons from that and how we can expand that for a new restart programme. We're also looking at options around the summer, what can be done there in terms of providing additional support. And I think importantly as well, alongside all of that, we need to consider what additional wellbeing support needs to be provided. Mark has been referring to the wellbeing framework, which to be fair, we were working on prior to the pandemic. So what we need to think about is what additional wellbeing support as a result of COVID will be needed. And I've been engaging recently with Siobhan O'Neill, the mental health champion, on that particular issue. We want to work with our education partners on this, of course, the Education Authority, but also school practitioners. We need to get their feedback on what sort of strategy do we need to put in place for education restart, what are the levels of support needed, and how best are we going to do that. So I can give you that assurance that those conversations are happening now within the department, and happy to come back at some stage, hopefully in the not too distant future, to give you a bit of an update where we've got to on that.
Thanks for those replies, and I think it would be useful. Especially, it's going to be difficult for children who are not vulnerable to return to school, I imagine. So people who are vulnerable returning to school will be faced with all sorts of challenges. So I suggest a lot of effort needs to go into framing that strategy, and I'd appreciate an update on that. Just two final points. I think it is quite concerning that there's no mention of respite services in the consultation. That was quite concerning. Also, we heard about mental health previously, but given the news this week that 50% of GPs in my constituency in West Belfast do not have any in-house counselling or mental health services, I am very, very concerned that people who are maybe vulnerable, children now, who very soon may be an adult and will be no longer under the care of CAMHS, have a 1 in 2 chance of seeing or not seeing a GP service in terms of mental health support. So is there any work being done on specifically looking at that and plugging that gap?
Mark, can you take those questions?
Yeah, indeed. So in terms of that, the kind of broader mental health support as people move to adult services and gaps in provision through GP services. There is the mental health strategy, which is out for consultation at the minute, which is looking to generally improve the mental health of the population and the services that we provide for people. I think we recognise the importance of continuing to roll out the primary care multidisciplinary team model, including the mental health practitioners based in GP practices. There's I think a commitment in there to looking again at our psychological services strategy, and we want to look at how we can expand and improve the current psychological therapies hubs and the provision that's made through them, because that's a key way of accessing talking therapy. So absolutely recognise the challenge that you're setting out, Jerry. I think we've put down some of the things that we would want to do in response to that through the mental health strategy, in terms of continuing to invest in psychological therapies, continuing to roll out additional support in primary care.
Okay, thank you. Okay, thank you, Jerry and Mark there. And moving on then to Alan. Alan, go ahead, please.
Thank you, Chair. Chair, I appreciate a strategy is only as good as the ability to deliver it. And I know that this is bound to have been a hugely challenging time for the department, and I'm sure that they have not been immune to staff being off self-isolating, and also they have been affected by the pandemic. But I'm just wondering, how have the department, have they managed home visits? And I'm sure that has been a big challenge. And have they been able to manage this issue to be able to maintain their level of service, given the staff shortages that they possibly have had? Second point, really, Ricky and Jerry there just alluded to it, but it's around the consultees had identified about homeschooling issues. And I suppose it is easy to identify parents who maybe don't speak English and may not have the capacity to homeschool their children, but there'll be an awful lot of other parents who don't have the capacity for whatever reason, and they're maybe just too embarrassed to admit that. So will there need to be a period at the end of this pandemic to maybe evaluate just where every child is at in relation to their educational development? Because through no fault of their own, they'll have fallen behind, and that may have implications for their educational development going forward. So that does need to be identified, and that does need to be dealt with. And I think it'll be a huge challenge. But as I say, does the department feel that we will need to do that, evaluate each child individually, both vulnerable and non-vulnerable, to see just where their development is at? Thank you.
Oh, okay, Alan, if I can start in response then to your question about home visits, and I think this has already been touched upon. So home visits are the preferred way of actually seeing children face to face, and that will happen where it can happen. There may be some circumstances where it isn't possible, and that's all subject to a risk assessment. If the risk assessment determines that it is not possible, then other ways of maintaining contact with that child and that family will be established, and I just want to assure you of that. In terms of staffing, then I think within social services, within children's services I'm speaking of, particularly, we didn't have the staffing challenges I think that we anticipated during the first wave of the pandemic, but that changed during the third wave. So we did have more staff out on sick leave, or more staff having to self-isolate. In terms of some of the things that we did to compensate for that, so you know that the department had a workforce appeal, and through that workforce appeal we have been able to recruit social workers and social care workers, and I think the plan at the minute is to put an additional 10 social care workers into each of our health and social care trusts, so that's in train at the minute. We did get graduates into the workforce more quickly than we would have done in any other year, and when we put those graduates in, we did put support and mentoring arrangements around them. We have used things like emergency rotas, so staff have agreed to participate in emergency rotas. We've used AHPs in our children's homes, for example, when we had difficulties staffing then, and again, those AHPs had some level of wraparound support and training made available to them. We have looked at skills mix. So within one of our trusts, the South Eastern Trust, the plan, it's not a plan, it's already happened. The trust has employed 21 qualified youth workers to work within children's services. And some trusts have just used different approaches. So within the Belfast Trust, within children's disability teams, they've developed what they've called a team around the child, and that's in place of traditional caseworker models of working, which means that when a child has particular needs, that any member of the team can pick that child's case up and deal with it more immediately, instead of waiting until an individual caseworker is available.
Just like to congratulate you for the how you've dealt with this particular challenge. Thank you.
Okay, thank you, Alan. So I'm just checking then with Cara. Cara, your hand was raised there as well. Can I check if you have a question?
Yep. Thank you, Chair. Can you hear me okay?
Yes, hearing you there, Cara, thanks.
Fantastic. Look, I'd like to thank the panel for coming before us here today. A number of members have touched on a few points I was going to raise, but you had mentioned vulnerable children include those who are receiving support or have been referred to child and adolescent mental health services. So I was just wondering, on that basis, I know like over the period of COVID-19, we've had, children and young people on their phones, their tablets, their laptops, they kind of have that increased risk and exposure online. So I'm just curious what kind of cross-departmental steps are being taken to protect children and young people from online harm, such as cyberbullying and grooming.
Okay, Cara, I'll pick that up. So there are a range of supports already available. So resources do exist, some of them available through NI Direct to support children or parents deal with online challenges. And you're quite right. I think children are at greater risk of online harm because of the pandemic. And it's one of the issues that we actually specifically identified in the plan as something that we needed to deal with. One of the other things that the department has done during the pandemic, in fact, it's not the department, it's a cross-departmental strategy. We actually launched the online strategy last week, the 9th of February, to coincide with Safe Internet Day. So that strategy is now in place. We will support the implementation of that strategy with an investment in the Safeguarding Board for Northern Ireland. So the Safeguarding Board for Northern Ireland will actually take forward some of the activity under the strategy, and they will be funded to do that. One other thing just to draw to your attention, that also during the pandemic that the department, DCMS and the Home Office have actually now published their response to the online harms white paper report, and the proposal is to introduce a duty of care that would apply to companies, make them responsible for the safety of people who actually use their services, and that includes browsing technology, and there will be an independent regulator actually put in place to oversee that. I understand that the legislation to make that all possible is going to be introduced in 2021. So in short, some support's already available for children and families. We've just published a strategy that's intended to increase those supports, and that will be further supported by developments taken forward by the UK government.
That's wonderful, thank you. My next question just refers to, I had seen in the consultation paper there around the Peace for Youth programme. I'm just wondering if you could expand a bit more on what that kind of entails. Thank you.
Ricky, can you take that one?
I would love to, but unfortunately I don't have the detail on that, Cara, so maybe I can come back to you on that if that's okay. Sorry about that.
No, that's fine. Thank you. And no problem. And just one last question then. So I had read one of the actions is to help with home learning via online resources, which is welcome. As we know, COVID has had a detrimental impact on education, things like rural barriers and digital poverty. But I'm just wondering, is there any kind of cross-departmental discussion or steps on, helping with the cost of broadband and Wi-Fi?
So I maybe come back in on that point. This obviously has been a big issue for the department since the beginning of the pandemic, and there has been an additional investment in terms of additional devices and so on, which have been allocated to schools and to various vulnerable groups of children. So I think we're at the point now of around 17,700 additional devices have been provided. There was also an announcement around Wi-Fi and mobile connectivity for children and young people, particularly in rural settings. So there were 2,500 MiFi devices, which is a mobile connectivity solution which has been provided, and then there have been Wi-Fi vouchers as well. So this is something that the department and the EA have been working very hard on, and we continue just to monitor and respond to demand that comes forward for it. So yeah, we want to try and keep supporting that as best we can.
That's great, thank you.
Thank you, Cara. Thank you, and thank you, panel, for those answers. There's a couple of, Eilish, there's one issue I did want to raise with you today. It's around the digital inequalities. And that covers clearly a number of areas, including broadband, rural broadband, access to devices, access to ability or knowledge or to use the devices effectively. So what steps are being taken to address that issue of digital inequalities?
Okay, so Chair, Ricky has partly picked up the response to that. So additional equipment has been made available to priority groups, and that includes vulnerable children, including looked after children. Some of that has been provided by the EEA. Trusts have also made provision fostering network, supported by the Health and Social Care Board by way of its contract, has also made devices available to children in foster care and software to children in foster care, and that's all to address the digital inequality that you are referring to. I think one of the things that the pandemic did expose is the extent to which inequality in digital terms actually exists among families, and probably is something that will need to be addressed by way of wider strategy going forward.
And what is your assessment of the access to broadband in certain rural areas? So getting onto the highway, having something to operate, it's one thing, but then in terms of rural broadband, do you have any idea of the impact of how many people might be impacted, or have you looked at practical support to provide broadband coverage, in some other way?
So my
is that covered by that MiFi that was referred to earlier?
So I think there've been a number of attempts at internet solutions, and they include some of the technology that Ricky has referred to. So the MiFi devices, dongles, SIM cards, BT vouchers, etc., have all been made available to address some of the internet difficulties that children and families might have. I can't comment on particular difficulties within rural areas, Chair. It's something we can follow up for you if like that.
I think that is an important issue, because there are obviously swathes of areas that are potentially not able to get on in any form, and that could be a worry as well. In relation to the chemical restraints, I just wanted to go back on that issue. Can you provide the committee with a detailed briefing of how often that is being used, what the increases are, and could you provide that on an ongoing, say on a monthly basis to us, Eilish, in terms of that chemical restraint, because that would be an area of concern, I feel.
Okay, I'm looking to Mark on that one, Chair. It's within his area of responsibility. So, Mark.
Yeah, we'll need to think, obviously, Chair, in terms of what groups we would want to see captured by that, if you see what I mean. So, if we'll go away and check with colleagues in terms of what information is captured on what basis and what we could share, and come back with a proposition for you, if that would be okay.
Okay, yeah. Okay, well, listen, that is fine. I want to thank you all for your contribution to our meeting this morning. I know we have mentioned there several times in relation to teachers and school communities and the work there, but I also want to acknowledge the social workers, the healthcare workers, the voluntary sector, everyone who's contributing, because I think we all recognise that safeguarding is everyone's role here, and I think it's crucial that people continue to remain alert to the potential of a child needing assistance or protection. So thank you for your attention this morning. We will continue on our consideration of your presentation and what further steps we might want to take in this very important area. But I want to thank you and wish you all the very best of luck, and stay safe and take care in the time ahead. Thank you.
Thank you.
Okay, thank you. Okay, members, so a lot in there, and a lot, I suppose, of concern and a lot of potential concern within that. So I suppose just do members want to contribute or come in on anything else there in terms of what we should be thinking? Yes, Carol, go ahead.
Sorry, I can't get any hands up on this. So I think it would be good to have a presentation from the Children's Law Centre and VoIPIC, which will include some of the children who were impacted, who are looked after coming out of care. The other thing, Chair, I wonder would it be possible just to write off and ask the department, because Lee mentioned it as well, see the issue of community and voluntary sector. A lot of them are being asked to apply to tenders, and a lot of them are asked for hundreds of thousands of pounds in reserves, as well as paying for what they're calling cybersecurity and indemnity. It's putting a lot of them out of reach. It's going to exclude the groups that everybody's paying tribute to. And I think it would be really good if we could write to the department and ask for a pause or for an update on the tendering process, and if it could be paused, because a lot of these groups that we're talking about are going to go to a wall.
Okay, would members be broadly content? I think in relation to the presentation with CLC and VoIPIC, we may need to look at an additional session for that, given the pressure on the forward work programme. But I think it is sufficiently important that we do, and we could possibly do a session where we hear from both of those groups. So if members are content with that, and also is ready enough to ask the department how they're managing the issue of tendering, is that the other suggestion, Carol, that you have? Asking the department to provide us a briefing? Yeah, I have an indication from Jonathan there, Cheryl. I'll come back to you. Sorry, Jonathan, go ahead.
I would be supportive of what Carol has suggested there in relation to those additional briefings. I think this is something that we're only scratching the surface with, really, and we really do need to find out a lot more information. I'm conscious of the fact that it's this committee's role to obviously scrutinise the COVID-19 regulations, and we have been bombarded in relation to every week considering regulations, but some of them have such an impact, again, with our other statutory committees. In relation to talking to a representative teachers body or teachers themselves to hear about this very impact that it's had on vulnerable children and what their observations are, I think it would be a powerful testimony for us to hear. That may have already happened at the Education Committee. I'm not sure. I haven't been following that. But I think probably in line with what we've heard today, it would be useful for us in some way, whether it's to see a report maybe that the Education Committee have had, or alternatively hear from some of the teachers that are experiencing these, maybe special needs teachers, would be useful at this time.
Yeah, well, we can ask the clerk to have a look at what the Education Committee has done in this regard that could maybe contribute, and we'll look at that. We'll look at that additional session as to how that might be organised. So are members broadly content with that? Okay, well, listen, members, I'm going to take a short break there. If we could come back, please, at 11:30. So that'll be a 15-minute break. I'm back at 11:30. Thank you, members, and we suspend the session.
This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the
Just wait for confirmation. That's us live now, Chair.
Okay, thank you, Clerk. So we are now members ready to resume our meeting, and we're going now to the next three items now on our agenda are SRs relating to coronavirus restrictions. A departmental official is here to brief the committee today on the provisions of these regulations and to take any questions that you might have. Can I refer members to the papers at tab 6 to tab 8 of your pack, which includes a clerk's memo at tab 6.1, and a copy of the principal regulations as amended to the 9th of February at tab 6.2. So I'd now like to welcome to our meeting Miss Liz Redmond, who's Director of Population Health. Good morning, Liz. Are you able to hear us okay?
Good morning. Yes, I can hear you. Thanks. We haven't had much success with the video, so today I'm just dialing in. And thank you very much for amending the time because I wasn't available at 11.
Okay, so that's fine then. And I now just go ahead, Liz, and invite you to go ahead and brief the members, please. Thank you.
Thank you. As usual, I'll take them all together if that's okay with you. So today we're considering SR 2021-18, SR 2021-27, SR 2021-29, which are amendment numbers 2, 3 and 4 of 2021 to the Health Protection Coronavirus Restrictions number 2 regulations, Northern Ireland. So I'll briefly summarise all three of these statutory rules and then be very happy to take any questions members may have. The executive had originally agreed that the current restrictions introduced on the 26th of December would be in place until the 6th of February 2021, subject to a review on the 21st of January. The COVID-19 infection numbers rose very significantly after Christmas, with the R value for new positive tests being between 1.5 and 1.9 by Monday, the 5th of January. So this was a consequence of the relaxation to restrictions prior to Christmas and intergenerational mixing over Christmas, which we've talked about before at this committee. At the time of the 21st of January review, there were extreme pressures on the health and social care system, and it was estimated that the third wave was at its peak by then. There had been a very rapid rise in hospital inpatient numbers and ICU bed occupancy, with 800 COVID positive inpatients across the system on Monday, the 18th of January. That was up from 542 on Monday, the 4th of January, so a 48% increase in 14 days. There were also 65 confirmed COVID positive patients in ICU. That was up from 39 on Monday, the 4th of January. So in 2 weeks, that was a 67% increase. And it was actually compared also to a maximum of 51 in ICU in April and a maximum of 52 in ICU in November during the first and second wave. So you can see from that the picture was escalating very quickly at the time. In addition, in January, we had this new variant circulating across the UK. And there was an increased frequency of detection of this in Northern Ireland by our local sequencing laboratories. This new variant was estimated to be up to 70% more transmissible than the previous variant, so significantly increasing community transmission of the virus. There was emerging evidence that the huge pressure that the health service was experiencing would not have eased significantly or sufficiently by the 6th of February when the regulations were due to expire to allow any relaxation of the restrictions to take place. The executive therefore agreed at this review on the 21st of January that the existing post-Christmas restrictions should remain in place until midnight of the 5th of March, with a review taking place on the 18th of February, that's today. So SR 18, Amendment number 2 of 2021, was made at 4:30 p.m. on the 2nd of February. These regulations came into operation on the 3rd of February 2021 and remain in place today. This SR amends the date that the Department of Health must review the need for restrictions and requirements imposed by Regulation 3 of the Principal Regulations to on or before the 18th of February 2021. Regulation 3 also amends the expiry date of the Principal Regulations to midnight on the 5th of March 2021. SR 27, Amendment number 3 of 2021, was made at 4 p.m. on the 5th of February 2021 and came into operation on the 6th of February and remains in place today. This regulation permits a customer to collect a Motability vehicle from a car dealership following an online application. This amendment was made to resolve an issue with the Motability scheme that had been brought to our attention. The Motability scheme enables individuals to exchange disability benefits for a payment towards a lease on a new vehicle. It's a legal requirement for new Motability customers to collect their vehicle, which meant car retailers were unable, within the terms of the Motability scheme, to deliver new vehicles to their Motability scheme customers, as they would be able to do for other customers. Restrictions on movement and on non-essential retail at that time prohibited customers from collecting vehicles from car dealerships. This resulted in new scheme users being unable to obtain a Motability vehicle, which obviously was disadvantaging people with disabilities. Whilst we recognise the need for the current restrictions and the very critical importance of the stay-at-home message, there was no policy intent to disadvantage any Motability scheme customer who required a vehicle for essential travel. The CMO's advice was sought, and he advised that this was low-risk activity if appropriate mitigations were in place. And that's why this amendment was made. So finally, the third of the three statutory rules that we're discussing today is SR 29, Amendment number 4 of 2021. This was made at 2 p.m. on the 9th of February and came into operation on the 10th of February, remaining in place today. This regulation made an exemption to allow the provision of driving instruction by or on behalf of the Police Service of Northern Ireland, the Northern Ireland Ambulance Service Health and Social Care Trust, or the Northern Ireland Fire and Rescue Board for the purpose of testing of the competence to drive a vehicle. This amendment arose from a request made to us by the Northern Ireland Fire and Rescue Service to allow them to resume driver training and testing for the emergency services. So you'll be aware that under the existing regulations, driving lessons are considered to be close contact services and therefore they're not permitted with an exemption for motorcycles. There was no exemption for emergency service to continue to provide this training. The department recognised that this was also likely to be the case for driving instruction provided by PSNI and the ambulance service. So following receipt and consideration of proposed mitigations from the fire service, PSNI and the ambulance service, this amendment was made to permit driver training to continue for emergency services altogether. So I hope that provides you with a summary of the context in which these regulations are made and an outline of their content. I'm happy to take questions, and as ever, just bearing in mind that these regulations cross over the responsibilities of many executive departments. So if I'm unable to provide an answer, I'll certainly seek clarification from colleagues subsequent to this meeting. Thank you.
Okay, thank you, Liz. And I'm going to go firstly to our Deputy Chair there, Pam Cameron. Go ahead, Pam, please.
Thank you, Chair, and thank you, Liz, for your brief there to committee. Obviously, we'll be content to support these rules, and the additional discretion for the Motability customers and public services providing driving instruction for their workers is very welcome and proportionate in the current climate. I wanted to ask you around shops, for instance, and the essential shopping. And I wanted to ask if the department recognises that the online sales are not a substitute for in-person visits to shops, and that's in particular in relation to nursery and baby goods, and also to children's footwear. Do you recognise that? And are we likely to see a phased opening that will see a move to appointment-only services, for instance? And I suppose if you have any update on whether there's any indication of click and collect services being made available for those very vital services in terms of new mothers and young children.
Thank you. Okay, Liz.
Yes, thanks. Thank you for your questions and for your support. On the essential shopping, this is very actively under consideration. The very services you've talked about with respect to babies, new mothers, new parents, and young children are certainly there as part of the consideration, particularly recognising absolutely that as time moves on, things that may not be essential in the short term can become essential as time ticks by. So I can't say any more about it today, but I can tell you that it is under consideration and the concerns you've raised are real and are recognised.
Okay, thank you for that, Liz, and hopefully we'll hear more, hopefully later today or in the very near future on that subject, but thank you for that brief. Thank you.
Thank you, Pam, and I have an indication then from Jonathan. Go ahead, Jonathan, please.
Thank you, Chair, and thanks for the presentation. Firstly, do officials have an update in relation to the review of the Assembly's scrutiny of the COVID regulations?
Yeah, go ahead, Liz.
I don't have an update on that to give you today. Apologies.
Okay, well, I would appreciate that, because I suppose that's been a fundamental question that's been asked by this committee since came on it, and I'm sure long before that. Is it likely that the consolidated regulations will be repealed in order to ensure we start from a clean slate for erasing the regulations as we have previously seen?
Yes, I recognise, I think we all recognise that we've got now just a very highly amended set of regulations which we made originally back in July. And our intention is, in fact, to move to a number 3 set of regulations to consolidate what we have and start again, as I think we probably all realise the reality of the next few months is that we are going to be making a lot of amendments as we take a proportionate approach to responding to the evidence as it develops around the disease and obviously impacts of the restrictions on our lives and the economy. So we're going to be piling more amendments on, and we do recognise the need to reset, I think would be the word I would say there.
No, I think it's going to be crucial that this committee plays a central role in that, given some of the concerns that we have had on record previously. How will we ensure that inconsistencies and grey areas are minimised when restrictions begin to ease?
Well, I think we've got a lot of experience now. We were certainly learning as we went last year. I don't think anybody had been in this situation before. It was unprecedented, and the rate of change and the complexity of these regulations, which, as I said in my introductory comments, span the entire breadth of government and society here. So we will learn from what we experienced last year. We've got some very active cross-departmental discussions. We have a meeting that we have every week and have continued to have that meeting, a cross-departmental meeting to specifically talk about these things, to try to iron them out. So I am very confident that we are learning lessons. It's not possible to guarantee that there won't be inconsistencies and grey areas in the future just because of the nature of this, and we have to be realistic. It is very complex and it's very unprecedented what we're doing. As all I can say is that we will be looking out for those things for sure.
No, I appreciate that, and I appreciate what you've said to my colleague Pam Cameron there in relation to click and collect services. I would actually, so obviously the Minister talked about the working group that was set up between the Department of Health and the Department of Economy. I would appreciate if you could give us an update as to what the final outcome of that was. And also in relation to those services that are needed or deemed essential, particularly as other restrictions are lifted. And I think particularly of schools in this instance, my colleague Pam has mentioned some of the particular nuances around new mothers, etc., and small children. But also, and I've experienced this where children are starting new school settings, sometimes vulnerable children, and there's an inability for them to access school clothing because of the nature in which those shops have now had to close. Will those particular businesses, outlets be taken into consideration? I'm thinking largely around those that supply school uniforms.
I'm not in a position to give you the outcome or an outcome today, but I can tell you that those discussions are very actively going on at the moment.
Well, no, I accept what you're saying, but surely, coming before the committee, you would have an update as to what the conversations have been on click and collect. I don't think it's acceptable that this discussion has now went on for 4 or 5 weeks. About 4 weeks actively in the Assembly, and we still don't have an update on that. We were told about the working group. What is the outcome? What are the challenges that are preventing click and collect to ensure that we have an adequate level playing field? And on the other end, as I've mentioned, will you take into consideration the particular nuances of those that are supplying school uniforms? So I don't accept just what you have said there.
Well, I do appreciate your frustration. I would say that this is a DFE-led piece of policy work that we're inputting into, and ultimately the Department of Health needs to make the regulations or amend the regulations according to what the executive agrees. So, as I say, I do appreciate your frustration. I understand why you're expressing those concerns. And I feel I can assure you that those conversations are going on very actively, and I hope that there will be able to be something said about that.
Okay, Chair, I'll leave it there. Not that I'm satisfied with the answers that I've got, but I appreciate maybe those discussions are maybe live today for an executive meeting, but the committee has to be given its place as well. Thanks.
Okay, thank you, Jonathan. And then I have indications from Carol Nichillen, Jerry Carroll and Paula Bradshaw. So I'll go firstly to Carol. Go ahead, Carol, please.
Okay, thank you for the update on these SRs. Like Jonathan, I'm only on the committee a few weeks, and I think the committee has been very patient and very collegiate in terms of accepting that often these rules come and people are all trying to do the right thing. However, I believe, and this isn't directed at yourselves, I think this is down to the Minister, that constantly relying on the committee to accept and look at statutory rules after the fact isn't the way to do it. Questions have been asked and answers aren't given, which isn't satisfactory either. We've asked questions, and I certainly have, regarding travel, particularly from areas with people with, like, for example, the Kent variant and passenger locator forms. And I appreciate they'll be more forthcoming, but I just want to put it in the record and raising it again. The other issue is, and you will probably appreciate this, outdoor training for young kids, even in a social distance way, is constantly coming up. It's impacting on the mental health of very young children, which wasn't the case before. And I do believe this needs to be discussed, as well as even the whole issues around, like, for example, detached youth workers that can't talk to some very vulnerable young adults and youngsters because of these restrictions, which we all support. But I believe just putting the same things down and expecting the same response needs to be recorded. I just think that while we are supportive as much as we can be, I just believe the committee's support has been taken for granted, and I'd like to have that recorded.
Thank you. Any comments on that, Liz, please?
Oh, sorry. Yes, I was going to take both of them. So the first set of comments was really around the process. So what we have is we're using emergency procedure, which has a different set of processes around it than other ways that we make statutory rules, and I'm sure you're all aware of that. And I think the question that Jonathan asked about the process, we will obviously have to look at that, and we've been asking questions about that, but there is a process that we have to go through, and the examiner needs to report and so forth. It is not the same as what we usually do, because this is an emergency and we're using an emergency procedure. So, we will respond on that, but I'm not able to do that in detail today. On the second part, I completely hear what you're saying, and it is a great concern to us in health, obviously, because it impacts on people's health. And I would say that there are exemptions in the regulations to accommodate people who have special needs and the need for care and for mental health support. So those allowances are there in the regulation. You're specifically, I think, though, talking about the population of young people in general being able to participate in sport and outdoor activity, and that is certainly very high on the agenda of discussions that we're having in our department and across the piece, in terms of looking ahead at where relaxations could be made first. So it's absolutely one of the key considerations.
Okay, thank you, Liz. And go on then to Jerry Carroll. Jerry?
Thanks, Chair. Thanks, Liz. I'm concerned, as well as others have expressed, about the process. It's been an ongoing endemic problem, but also concerned about the possible policy being adopted. And I suppose, obviously, around the amendment to extend on the restrictions, Liz. There's obviously discussions today, a review today of that. I want to ask, what is the department and CMO and ministers' view and advice, generally speaking, because we obviously have heard a lot about R and the R rate coming below 1 before we consider lifting restrictions. But, in reality, R could drop, but there still could be hundreds of people in hospital, as there are at the minute. And I'm concerned that there's going to be possibly a plan to lift too soon again when there's too many deaths, too many people hospitalised. So what assurances can we get that that's not going to be the proposed strategy from the department, minister and the executive? That's my first point. The second point is on the emergency services in terms of the driving lessons. How many people is that expected to be? I would guess it's small numbers, but if it's large numbers, it would be require further scrutiny. So to have an assessment or an idea in terms of the numbers proposed to be involved in that.
Thank you, Jerry. Liz, go ahead, please.
Yes, thank you. Just on the emergency services, this won't be big numbers because it's just to make sure there's a continuous flow of new suitably qualified drivers for those vehicles. We don't want a big interruption to that as this is extended into a longer period than initially had been intended. Your initial point then, clearly this is a point of discussion with the executive today, probably right now as we speak. So I won't be commenting on that in detail, but the point that you make about just because R is less than 1 means you can lift restrictions is a very valid point, which I think most people now understand. If R is less than 1 and you still have a very high level of occupancy in our hospitals, which we do still have today, then you could just, if you ease restrictions, you could just end up piling more people in behind and raising the pressure on the hospital system again, which is something we definitely want to avoid. We also have not yet reached a level of vaccination coverage in our community to protect the most vulnerable. So we are very, very wary about this and know that the R value alone, it can't be taken alone. It's necessary, but not sufficient, I think would be my summary.
Yeah, I appreciate that. And I appreciate you're not going to divulge what's being discussed at the executive or suggested at the executive. But I also think it is concerning that, we're not hearing what are the main principles driving the executive or the minister and the department's approach. So obviously it's to reduce numbers and reduce hospitalisation. But beyond that, at what stage does the department and the minister see that it's safe to open and lift restrictions? Because, like I said, my concern is that this is going to be done quickly, too soon. So unless the department and the minister is advising against that with a plan in place, then we're subject to the same problems that were in place last year. So can you give us a sense even of the 2 or 3 or 4 or 5 guiding principles that the department is working on in relation to when it sees fit to lift the restrictions?
Yeah, go ahead, Liz.
I'll start by saying that the bigger strategic piece on the sequence in which we lift restrictions is under development, or should I say it's being refreshed because we did this last year. So we're heading into another round where, all being well, we will be lifting the restrictions in sequence. So there is a strategic piece of work going on now, again, very actively between all government departments led by the Executive Office with ourselves, the Department of Health, feeding into that in terms of the health intelligence, if you like. we will, in that piece of work, be revisiting guiding principles and all of those things that you just covered. So you'll hear more about that. But I think you've really summarised a lot of them yourself. So we want to know, how much pressure is on that hospital system, how much can it bear. That's obviously really critical. And then I mentioned the vaccination coverage is obviously going to be important as well, just the overall level of immunity in the community. We've also got, and I'm not saying this is a guiding principle, but something very important to mention in this conversation is the threat of the emergence of yet more variants, and in fact variants that are more dangerous to us in that our immunity, whether that's acquired through natural exposure to the virus or through vaccination, may not be protective against infection with a new variant. And our interim chief scientific advisor informs me that if you've got community circulation of the virus, as we still have now, then you've got more chance of getting those types of variants emerging, because it's a natural biological process, isn't it, for the virus to select or to be selected to basically get around our immunity. So, I think that makes a lot of sense. So we need to be very careful about those new variants as well.
Okay, thanks.
Thank you. Okay, going then to Paula Bradshaw. Go ahead, Paula, please.
Thank you, Chair. It might sound a bit repetitious, but I do want to come back to the issue of the click and collect. On Saturday, I was in one of our big supermarkets, I'll not name it, and I feel a wee bit like you're not stuck in traffic, you are traffic. But it was absolutely bunged, and it was because a lot of people were calling into the supermarket to collect their flowers and their cards and presents and stuff, and that's because the non-essential retailers were closed. And I'm concerned that I came home actually and said to my husband, it was like COVID central, and I'm concerned that the information that the contact tracing service will receive going forward in terms of transmission will come from retail, and that could then have an impact in terms of consideration for opening other retailers going forward. And I think that would penalise in many ways those small retailers who have not been able to reopen because of that. So I just want your thoughts on the concentration of people going through our deemed essential retail shops at the minute.
Yeah, thank you, Liz.
Yeah, no, thanks for those observations, and they're valid ones which we need to make sure we're mindful of when we're examining the data and looking at what we do next. Yeah, I think that's all I can really say about that at this point.
Thank you. My second question relates to the driving lessons and tests for the emergency services, and I very, very much welcome that. I think that the work they've been involved in during the pandemic has been so exemplar. I'm just conscious that there's also then our health and social care workers who are also waiting to secure their driving test at the minute, and I'm just wondering if it's any special provision going to be made. There was at one point in the pandemic, but that was withdrawn again, and I'm just wondering where the Department of Health is in terms of negotiating with the Department for Infrastructure around that issue. Thank you.
That hasn't come to my attention actually as a request. It certainly hasn't reached its way to us as a request for amendment to the regulation around that. That's not to say there aren't some conversations going on. So yeah, all I can really say today is that I'm not aware of that being made as a specific request. However, there are potentially other drivers that you could argue would be in a priority area, such as those delivering food to us. So I think the whole issue of driver training and driving instruction will come around. They are part of the close contact services at the moment in the regulations, the definitions of the regulations. So that's why they're required to cease operating.
Okay, thank you. And I don't expect a response to this, but just want to put it on your radar. It just occurs to me that the driving centres where, there's a huge backlog of people waiting to get a test, but would there not be the opportunity to introduce like rapid testing? So, the way they have it now in the emergency departments that take 12 to 15 minutes to get a result, to protect the driving testers, could the people who are trying to take the test, could they not be subject to this rapid test before they got in the car? I think that could possibly unlock a lot of the blockage in the system around that, around concerns. Thank you.
Yep.
Yes, there's work streams looking at how rapid testing can be deployed in a lot of realms of our lives and the economy. So, that's certainly something that could be looked at.
Okay, thank you, Paula. And Liz, just in relation to some of the things you said there and in relation to some of the questions around the whole process, and you'd mentioned the very real and the very widely acknowledged threat of new variants. But also in terms of, you had mentioned in the course of your contribution around assessments that are made around, for example, and I think this is what you said, was that what that hospital can bear. But that seems a very, very minimalist approach and a very dangerous approach, that we're considering what do we need to do at a minimum to just keep that hospital. And when we talk about hospitals, we're talking obviously about hospital staff. And we have pushed hospitals and frontline health staff beyond what they can bear as a result of this pandemic. So I'm curious now, a year on into this pandemic, why we're not looking at what's the maximum we can do to ensure we have the least virus transmission possible, rather than keeping the system right up at a point where it's assessing where the breaking point is. Why don't we take a maximum suppression, zero COVID, no COVID, whatever approach you want to call it? But why is there not more energy at this point in time? I think we all understood at the start that there was, unprecedented circumstances, and we were seeking to manage a very difficult situation. But as time has gone on, the lack of ambition appears to me quite striking, I have to say. And while we cannot create invaluable healthcare staff overnight, nurses, doctors, domiciliary care workers, all of these staff, we could employ more contact tracers. We could use maximum suppression there. So where does that figure in the department's thinking when they're considering what regulations are necessary or what actions they can take? Where is that ambition to seek to suppress COVID-19 transmission entirely to the greatest degree possible?
Okay, well, I would say to you that is what we are doing. And I think whilst I might have said what hospitals can bear, I think perhaps you've slightly misunderstood what I meant. And my real concern, and all of our concern, is the totality of the capacity of hospitals to deal with not just COVID patients, but non-COVID patients. And I think that is a growing issue, as I'm sure you're aware, in terms of waiting lists and people just being able to access the treatment that they need. Well,
that's exactly the point. That's exactly the point that I'm making. The point that as a result of allowing, or a result of increasing sort of transmission rates, then red flag surgeries and other life-saving procedures are potentially at risk.
Yes, I think my point really was to say that I understand that what you're saying, and that perhaps if I made some reference to what hospitals could bear, I wanted to just make it absolutely clear that I wasn't talking about what is the bare minimum that can be done to stop hospitals being in excess of capacity. I was not saying that at all, and I just want to put that on the record.
And I do appreciate it. I'm not directing that at you personally, Liz. But what I'm saying is there appears to be an overall approach which is based on what do we need to do to keep things below breaking point, rather than what can we do to ensure maximum suppression of this virus in our community.
Well, I would just want to contest that, because I think we are, in fact, looking at and, in fact, doing the maximum that we can do to suppress this virus. That is exactly what we are doing. And all of the things all of the tools that you have mentioned, we are deploying. So restrictions, which is the reason that I'm here. We've talked about, you mentioned the test, track and trace system, which is absolutely, in fact, it's running very well. And the lower we can suppress the virus in the community, the better that system is going to work for us. And the restrictions are needed to suppress that community transmission of the virus. We also are doing very well on the vaccination program rollout. Our limiting factor is not the ability to get vaccine into people, it's the supply of the vaccine, which is a global issue. And the UK as a whole is doing very well on obtaining supplies. So I actually just want to say that I think we are pressing down very hard and using all the tools available to us.
Okay, well, that is the role of this committee, to ensure that continues to be the case, and that all steps are being taken, that while everyone should be doing everything they can on an individual basis, but the Department of Health have a strategy and have that strategy implemented that will impact on the need for this. And we're now in a number of series of lockdowns, which all of us recognise are very difficult in terms of social and mental health and well-being and economic activity. So it's something I think we absolutely need to see that type of maximum strategy being deployed. So thank you for that, Liz, and thank you for your attendance here this morning. We will continue on with our consideration of each of the SRs, but we can let you go now, Liz. But thanks for coming along and answering members' questions this morning.
You're welcome. Thank you.
Thank you. Okay, members. So we'll now consider each of the SRs in turn, as we normally do. All three of these SRs are subject to confirmatory resolution. And this will be the committee's last opportunity to consider these particular regulations before the debates in the Assembly, which are scheduled for the 22nd of February. So first of all, to SR 2021/18. I refer members there to tab 6 of your pack. And can I remind members that this SR amends the date that the Department of Health must review the need for restrictions and requirements imposed by the principal regulations on or before the 18th of February 2021. This SR also amends the expiry date of the principal regulations up to midnight on the 5th of March 2021. The Examiner of Statutory Rules has no issues to raise in respect of this SR. Have members any further issues they wish to raise in connection with that statutory rule? No, I see no indication there. So if not, then can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Number 2, Amendment Number 2, Regulations 2021, and recommends that it be confirmed by the Assembly. Are we agreed? Agreed. Thank you, members. Moving on to SR 2021/27. And I refer members to papers at tab 7 of your pack. Can I remind you, members, that this SR provides for exceptions to the restrictions on non-essential retail businesses. The Examiner of Statutory Rules has drawn attention to an issue arising from the drafting of this rule regarding the collection of mobility vehicles, which the Department has agreed to amend in future regulations. Have members any further issues to wish to raise in connection with this statutory rule? Jonathan?
I just wanted on record, I'm not going to oppose the regulation, but that my concern about the lack of information that we've received around the click and collect services and the equality issue that there seems to be relating to multinationals and small independent retailers. Been on record saying that now for a couple of weeks, and I don't feel that we've satisfactorily been given answers to both here at the committee. So I just want that in the record.
Okay, thank you, Jonathan. And if there are no further issues, then I'll maybe move on to ask members to agree formally that the Committee for Health has considered SR 2000. Yes, go ahead. Is that Carol?
Yes, sorry, Chair. I would just like to put that concern on record regarding them all. To be honest, even some of the questions that you asked the officials at the end, we're not getting the answers that we deserve. Even if they can't answer, to go away and try and get an answer seems to be lacking. I believe there's equality implications in all these regulations. We always understand that they're an emergency, but the way in which they've been brought forward and the whole process is questionable. So I just want that recorded.
Yeah, members content for that to be recorded as well. Okay, members, thank you for that. So going then to our formal consideration of the SR, the Committee for Health has considered SR 2021/27. The Health Protection Coronavirus Restrictions number 2, Amendment number 3 Regulations 2021, and recommends that it be confirmed by the Assembly. Are we agreed? Agreed. Thank you, members. And finally, in terms of these SRs, then SR 2021/29, I refer members to tab 8 of your pack there, members. I remind you that this SR allows for a person to provide driving instruction when that service is provided by or on behalf of the PSNI, the Ambulance Service, NI Fire and Rescue Board for the purpose of testing of competence to drive a vehicle. Have members any further issues to wish to raise in connection with that statutory rule? No indications. Thank you, members. So then can I ask members to agree formally that the Committee for Health has considered SR 2021/29, the Health Protection Coronavirus Restrictions number 2, Amendment number 4 Regulations 2021, and recommends that it be confirmed by the Assembly. Are we agreed? Thank you, members. Okay, members, we're moving on then to an item of business this morning, which is an SL1, and it's the addition of vitamins, minerals, and other substances amendment regulations NI 2021. And I refer members to the clerk's memo at tab 9.1 of your pack there, and to the SL1 papers at tab 9.2 and 9.3. I can advise members that the Food Standards Agency is proposing to make a statutory rule to amend existing regulations to provide for the enforcement of EU regulations on the addition of vitamins and minerals and of certain other substances to foods. Members will recall that it previously considered this policy proposal in June 2020, and the related SR was considered by the committee at its meeting on the 21st of January this year. However, the rule had to be revoked because of draft errors, and this SL1 relates to the new SR which the FSA intends to now make. There are no changes to the policy objectives from the original SR which we discussed. So is the committee content that the department makes the statutory rule? Yeah, committee is content. We are agreed. Thank you. Okay, members, moving on then to correspondence.
Sure, I had my hand up there.
Sorry, I didn't see that. Jonathan, go ahead.
No, just to put on record, I suppose probably there's nobody here to answer questions, I don't think, from the...
Well, let me just check with Clerk. I think there may be... Clerk, do we have officials available online to answer questions?
Yes, Chair, we're just getting somebody on the call now, so hopefully we should have somebody on in a matter of a minute or two.
Okay, so we'll just pause and wait for that official to come online, members, and we'll come back to you for your question then, John.
Sorry, Chair, there's Sharon Gilmore's on the call now, so we can bring her in.
Okay, thank you. So, yeah. No, I suppose probably just...
Good morning, Sharon. Good morning, Sharon. Just welcome you to your committee. I appreciate you being available to answer questions. So I have one question at this point from Jonathan Buckley, and I'll keep an eye out for other members, CPAM Cameron as well. Go ahead, Jonathan.
Yeah, no, it's just obviously, I remember whenever they were drafting ours with this, and I had some concerns then. So importantly, this rule does not seem to be directly connected with the protocol. However, there will be wider issues around the manufacturing of food and the potential for regulatory divergence across the UK as we move forward under the current Northern Ireland Protocol, which is extremely worrying, and what that implications that will have. So could I just confirm, is it correct that this rule isn't directly linked to the protocol, and how could this legislation be impacted by UK divergence moving forward?
Okay, what I would say, Chair, is the EU regulation does sit within Annex 2 of the Northern Ireland Protocol, so it is impacted as such. The SR is that we are amending is amendment to the 2007 Northern Ireland regulations that implement the EU regulation. In England, Wales and Scotland, the retained EU legislation that has been brought in currently parallels the EU regulations that we're seeking to amend. So at this moment in time, the regulations are a mirror image of each other and there is no divergence. So that's not to say that that could not happen in the future, but assurances would be that any changes, this particular EU regulation and the GB retained EU regulation set out very strict conditions for any vitamin, mineral or other substance to be added to any annex. In that, they have to be authorised and go through a safety assessment before there could be any changes. So in the EU, that would be the European Food Safety Authority, and in England, Wales and Scotland and the United Kingdom, that would be through independent scientific committees. So yes, there is a connection with the Northern Ireland Protocol.
Well, I would have a lot of concern with this, as other parts of the Northern Ireland Protocol and in relation to this is coming forward. So I want to register my concern, and there will be further opportunity to discuss this.
Okay, thank you.
Thank you, Jonathan. And Pam, go ahead, Pam.
Yep, thank you, Chair. Thanks, Sharon. Sharon, I just want to ask you a couple of very quick questions. Is the parallel legislation in GB already in place? That's the first one. And I wanted to know if you can tell us more about how the Republic's enforcement will differ from Northern Ireland's. Thank you.
Yes, thank you. The parallel legislation in GB, yes, is already in place. And in Republic of Ireland, yes, it's already in place as well. This particular amendment is to bring in line the enforcement regime for Article 8 and Annex 3 is to extend the enforcement that's in our current implementing regulations for 2007. So we're hoping to bring that forward as soon as possible. And then all the regulations will be in parallel across both United Kingdom and Ireland, Republic of Ireland and ourselves.
Thank you.
Thank you. And I have an indication from Alan Chambers. Go ahead, Alan, please.
Thank you, Chair. Just like Jonathan, I would have concerns around this. When we had the presentation from the Food Standards Agency, I did ask that in the unlikely event of any divergence, who would have primacy of decision making, and I was told it would be the EU scientists that would have the primacy. So I certainly have, like Jonathan, I would have major issues with the protocol and would not be supporting anything that was designed to copper fasten any aspect of the protocol, Mr. Chairman. So I want to register that my objections at this point and would not be supporting this at this particular time.
Thank you, Alan. And I have an indication from Carol Nicullen. Go ahead, Carol, please.
So I would just wonder if the EU directives still stand and have been put into the protocol to ensure that food standards are adhered to. Is that correct, Sharon?
Yes, that's correct. Yes.
So irrespective if they were in the protocol or not, the Britain is even going ahead with the EU directives as they stand. That's correct?
Yes, all legislation has gone forward as retained EU legislation, yes.
Yeah. No, I mean, that's good. It would be it's a pity that people aren't as vexed about inequality as what they are about constitutional issues, but there you go. That's just my political comment.
And this particular EU regulation sits within the Nutrition Labelling, Composition and Standards Common Framework for United Kingdom. So the framework that was discussed a few weeks ago. So any changes that would happen or any opportunity for divergence from GB would be discussed through the Common Framework governance, of which Northern Ireland is a full participant.
So basically there's no change. The EU directives stand as they are, and every every parliament has signed up to them because it's the right thing to do.
Yeah, and Sharon, can I just check with you? So these series of measures are taken essentially to ensure that we don't see divergence from Europe, which and I'm very conscious here, even in my own constituency, we have a massive food production industry, and divergence could spell ruin for those businesses in terms of trying to operate production systems, an integrated production system across the island of Ireland, but also access into European markets, which I think we all agree that Europe are famously protective around their food, what makes up their food. Am I correct that that's the purpose of the SL1?
The SR is about extending the offences that for Article 8 and Annex 3 of the European regulation as it stands at the moment in Northern Ireland. So it's about extending the Northern Ireland implementing regulation of that EU regulation. It was in 2007 when the regulations were brought into force. Article 8 and Annex 3, there were no substances that were prohibited, vitamins, minerals, or other substances. So this is an omission that happened in 2007, and this particular SR is extending those enforcement regime for that particular offence.
Okay, thank you. Okay, thank you. Any other questions for Sharon, members? No, I don't see any other indications. Thank you, Sharon, for being on hand and for coming online and answering and addressing those questions from members. We can let you go there now and we'll continue on with our consideration.
Thank you, Chair. Thank you.
Okay, members. So we have on the record from a number of members they're concerned, but is the committee content that the department makes the statutory rule? Yeah, agreed. Thank you. Okay, members, moving on then to correspondence. Can I draw your attention to a number of items there within correspondence? First of all, item 10.2 is an analysis of the responses to the department's continuing healthcare consultation. Members will recall that the committee received a copy of this consultation document in October and agreed to note it pending further scrutiny when the consultation responses were received. The committee also agreed to schedule a briefing session with the department and stakeholders. So do members have any comments on that at this point in time? Continuing healthcare? Okay, I'm not seeing anything then. So I think it may be useful to, I thought when reading through the continuing healthcare, and it is a crucial issue, but there was very little information on timeframes and the action plan for how that will be taken forward. Would the committee be content that we write to the department asking for more information on timeframes and action plans?
Yes, Chair, and could we also ask, does the department have a COVID recovery plan in relation to this as well? Because this is all kind of set in the context of ongoing health, which is grand, but the fact that there's not even a draft recovery plan is concerning.
Yeah, members content with that to be included? Thank you. Okay, then item 10.3 is correspondence from the Minister regarding the launch of the department's distance awareness scheme, which aims to promote adherence to social distancing and other COVID protection requirements. The letter is seeking the committee support for that scheme. Any comments, members? Yeah. Well, okay, I don't see anything in it. I thought the committee have been fulsome and full square behind supporting public health messages. I think that has been put on the record at every opportunity. So, and I think we certainly would continue to support all those public health measures. But I think we also have indicated to the department that we are extremely keen to see upscaled capacity in terms of the whole find, test, trace and the public health measures. So I think it's something of note that the department needs to keep the committee appraised of progress on their responsibilities and what it is they're doing to improve the situation moving forward from what we have seen in the past. So I wonder, would members be content, in light of the motion that we brought to the Assembly, would members be content, and I know the Minister touched on it last week, but I think it would be useful to get a detailed briefing of how that find, test, trace system has been upscaled and what the capacity is within it at the present time. Would members be content with that?
Great, Chair.
Yeah, thank you.
Chair.
Okay. Yes, Pam, were you looking in there on that one?
Yes, I was. Yes, thank you. I don't disagree with what you've said there, but I suppose it's just say, I mean, we don't have any objections to this campaign, obviously, but I think, that there is an onus on the department to communicate effectively and let us all understand the need. I think there is a bit of a risk of disconnect with the wider public on the issue, who have already sacrificed so much and don't and maybe won't clearly understand why the vaccine will take so long to have tangible effect. So I think it's important that the department needs to understand that they need to communicate very, very clearly with the public to inform us all of what's happening and what the processes are and what the thought is behind this campaign and why the need. And I think we just need it spelled out more clearly to the public and to us as to how we're going forward with the whole thing. But I don't disagree with your comments either. Thank you.
Yeah. Okay, thank you. So there was also an item there, 10.13 is a letter from the PPI panel from the Southern Health and Care Trust in relation to vaccinations. Just to note that, and just to, I suppose, to declare an interest that I have actually worked with that group here in the local constituency, both as part of my social work training, and I know they're a very good example of people taking agency into their own hands and impacting on policy. And I think it's great to see groups like that communicating with the committee. So item 10.15 is a response from the Northern Health and Social Care Trust to the committee's request for information on the evidence and modelling used to inform the Trust surge plans following the evidence session with some of the trusts in January. Have members any comments in relation to that response? No. Okay. Chair. Members can have it. Yeah. Pam, is it? Or yeah.
Yeah.
Go ahead.
Pam, yeah. Thanks. It was just in relation to that particular issue. It'd be interesting to know whether the planned activity, the element of the surge modelling, is coordinated by trusts or whether it's coordinated regionally. So really, who's making the final decision on whether it's needed to cancel elective surgery, etc. It would be good to get that information. So could be right back and maybe and get that.
Okay, and I've also got an indication from Paula. Go ahead, Paula.
Chair, mine's in relation to correspondence further on in the pack. You want to come back to?
Okay, I'll come back. I'll come back to you on that, Paula. Jerry, is this in relation to this item? In relation to the Northern Trust?
Slightly later, Chair. Slightly later item.
Okay, I'll come back. I'll come back to you both. So have members any comments or proposals on any other items of correspondence? Now, this is not the papers yet. We haven't moved that far, but just in terms of any other pieces of correspondence in the main pack today. And if not, our members, go ahead, Jerry.
Thanks, Chair. Sorry, at 10.18, I think it's in the correspondence pack, in regards to the increased support for people who need to self-isolate from Dr. Kunzman, and obviously Ciara Fitzpatrick was talking about this issue quite a lot this week. I think it's an important intervention. It's something that we have I think talked about in various guises about the need for proper support systems for people to isolate. So I think it's a positive paper highlighting a problem and a gap. And I think we should write back to them, thank them for their correspondence and welcome their findings. And I would like to see the committee endorse what they have argued for in the paper.
Well, I think that's probably would be done in any case in terms of writing back. I note that we have suggested here that we forward to the Department of Communities for comment, and maybe if we done that, and then we could come back based on the comments that we get back from communities, we could look at that again. Then, would you be content with that, Jerry?
Yes, so I charge that. So forward it on to communities, and then we'll get a response back.
Forward communities, yes. Forward that correspondence on to communities and get their response back on that.
Okay, thanks.
Yeah. Okay, thank you, members. I'm moving on to table correspondence then. So the table pack contains two further items of correspondence. First of all, there's correspondence there from the Minister advising that he plans on introducing the Health and Social Care Bill on the 8th of March. The Minister has supplied an in-confidence briefing of the bill for members and advised that officials are available to brief the committee on the principles of the bill. This briefing is currently scheduled for the 4th of March. And I just want to check there, I have an indication from Ciara. Ciara, are you looking to come in on that bill, or are you looking to come in on the previous item?
I was just looking to come in on correspondence 10.8, but is that okay to do now, or do you want me to wait?
Okay, we'll go quickly back to that and I'll revert to the other item of business. So go to 10.8 then.
Apologies for that, Chair. No, I just want to speak in support of Pat Catney's letter on surrounding period poverty and the support for pushing for free sanitary products in schools, universities and educational institutions. Just to note that it's an essential health need, and I'm lucky enough to share an office with Pat, and I know how passionate he is about this. So, and it's noted very well across all parties about the impact it can have on education as well. So just that I think as a committee we should give that full support. Thank you.
Yeah, and we've indicated there that we wish to note that pending introduction of the bill. So I think that will return to us as a piece of work for scrutiny at some point in time. Thank you for that. So, members, going back then to table papers, correspondence from the Minister advising the plans on introducing the Health and Social Care Bill on the 8th of March. He supplied an in-confidence copy of the bill for our members and advised that officials are available to brief the committee on the principles of that bill, and that briefing is currently scheduled for the 4th of March. So, are members content with that? And I think we will also need to get information about what bills are coming, because we are going to see a number of substantial pieces of legislation coming, and we're going to have to go through those in detail. So we clearly need to consider how we manage that in terms of our forward work programme. So no further comments on that then, and moving on then, we've also received a copy of the Severe Fetal Impairment Abortion Amendment Bill and explanatory memorandum. The committee will have responsibility for committee stage of this bill if it passes second stage. So it has came in very, very late, I have to say, and I think we should defer to next week and put it back on for next week, because I'm conscious it's a very significant issue and that members will want time to consider it. But I also think that there's indications then from Paula. Were you looking in? And I'll go to Jerry after that. Go ahead, Paula.
Thank you, Chair, and I appreciate that this is not the time maybe to open up the conversation around it, but I just wanted to raise two particular issues. First of all, it says the member is satisfied that the bill is human rights compliant. I wonder, can the committee write to the Northern Ireland Human Rights Commission and ask them for their opinion on human rights compliance? And secondly, when I raised a point of order in the chamber this week with the Speaker during its first reading, he said that he was satisfied about the competency of this. The wording of the bill says that it seeks to amend the law. The law was passed in Westminster, and you cannot repeal an act by substantially changing the wording in the regulations. And it's my assertion that that is what this proposed bill from Paul Gibbon is seeking to do. So I'm wondering if we can ask the Speaker to provide the committee with the legal opinion that he has satisfied himself that this bill is competent, and if it's legally privileged, whether we as a committee can seek our own legal opinion on this, because this is a very, very substantial deviation, in my opinion, from protocol and standing orders. So two requests: Northern Ireland Human Rights Commission and also legal opinion. Thank you.
Sure.
Okay, I'm going to go to okay, Carol. I have Jerry, Carol, I have Jonathan Buckley, and then I'll come to you, Carol. So I'm going to go with Jerry, Carol first.
Thanks, Chair. Thanks, Paula, for raising it. I want to support Paula's proposals on the writing to the Commission and getting her legal advice and seeking a copy of the legal advice that was gave presumably to the member around this issue. But also I just want to say, Chair, I know we're coming back to it possibly next week, but in a context where women still can't get abortions in a lot of trust areas, where people are still being forced to travel, where women are being made to feel suicidal because they can't get access to pregnancy terminations. I think this bill is definitely unfortunate in that regard. And also, we're still seeing the health minister, refuse the act, even though he's legally required to do so. He has legal powers to do so under the legislation. I prefer to see it as a contentious issue, and I think that's a real shame. But I'm going to support Paula's proposals as well.
Thank you. Jonathan?
Yes, thank you, Chair. And firstly, can I say I welcome this bill by Paul Given. I think it's an important intervention which will protect life, and in particular some of the very vulnerable members of our community, including those with severe disabilities. I just said that I would disagree with Paula's 2 points, and the clerk can maybe keep me right on this, but obviously I know that the Speaker has ruled that this bill is within the legal competence of the Assembly, and I look forward to getting towards that second stage. But the clerk can maybe confirm that convention is that 4 weeks after introduction, we have a second stage debate, which is on the general principles of the bill. Normally at committees, there's now a 3-week gap for this committee to discuss the general principles of the bill. And I know that the bill sponsor, Mr. Paul Given, would be available to come to the committee to give the committee an opportunity to discuss the general principles. I think that is custom and practice, and maybe the clerk can keep us right. But going to, if we hopefully we can get past second stage, surely then that's the ideal opportunity for detailed scrutiny by this committee. You know, there's an opportunity obviously for us to advertise and allow for responses and oral evidence and detailed scrutiny, meaning that the Human Rights Commission and any other body that have an interest in this particular piece of legislation will have the opportunity to put on record their concerns and for this committee to scrutinise that. I think that's something that should be welcome. I don't think there is a fear at all, or we should never be holding back from this committee doing its job, which is scrutiny. And I do note some that are now questioning the scrutiny and the compliance with this legislation, but they were notably silent when Westminster passed this piece of legislation with no consultation, no scrutiny, with just 17 minutes of debate on an issue of life and death. So I'm open, and I know that the bill sponsor is open to full scrutiny and engagement to ensure that this committee is adequately equipped to deal with this as it goes through its stages in the Assembly.
Thank you, Jonathan. And Charles?
Yeah, well, first of all, I have no issue with the Human Rights Commission. Their view in this, I think that's, reasonable. The only issue is that, any legal advice is privileged. No one has to share that, but certainly you could ask for it. And I would like to see the human rights advice as soon as possible, because what we don't need is the proposer of the bill coming to the committee pontificating. And I would like to see the basis of which the legal or the human rights compliance from someone else other than the proposer of the bill.
Okay, Alan?
Yeah, it wasn't answered.
Yeah, well, I'm coming back on those, but I want to get views from all members first, and then I'm going to come back on. Go ahead, Alan.
Thank you, Chair. Chair, I'm making these remarks without prejudice, and I'm looking forward to the debate around this bill. I think it will be a useful debate. But just in the meantime, just procedurally, and we'll talk about due process. I wonder maybe if the clerk could advise if indeed, have we the authority today to be requesting? Is it not premature that it hasn't really landed on our desk yet as such formally? So are we premature in seeking the information that we're seeking? I'm not saying that we shouldn't seek it, but I'm just thinking about the timing of it. Is there a right time to ask for it? And is this the right time? So maybe the clerk could give me a guide in that.
Yeah, thank you, Alan. And I'll be coming to the clerk now very shortly. Jonathan, you were looking back in there.
Yeah, no, Chair, I was just basically, I thought the clerk would have come back to me directly, but I'm happy for him to come back and clarify what is the normal due process in relation to a private member coming to brief a committee before second stage.
Thank you. And Paula?
Thank you, Chair, for letting me back in. Just for Carol's benefit, possibly, whenever the Attorney General gave some legally privileged advice to the Health Minister and the commissioning of the abortion services, we were privy to that, but we were provided it in a passcode protected email. So we have had that in the last year. But the reason why I raise it at this stage is because I would like the clerk to investigate whether we can commission our own legal advice, because I don't know what the proposer or sponsor of the bill actually asked for, because you'll only get an answer to what you ask for. And I'm happy to provide the wording to the clerk for dissemination around the rest of you members as to what I think the legal advice should be. And the reason why I'm raising it now is because it may take a few weeks to come back, and I don't want us to proceed to second stage or further without having that in front of us. Thank you.
So if I could then go, Clerk, to yourself, just in relation to, there's a number of issues arising. So there's the suggestion, the proposal that we write to the Human Rights Commission and seek legal advice. And Alan has queried whether that is premature at this point in time. And also Jonathan's question around the normal process at this point in time. And all of this now, I do want to state all of this in the context of this significant legislation only coming to us last night in table papers. So, Clerk, can you advise there, or do you want us to go into? Do we need to go into closed session to take some of that procedural advice, or are you content to address those issues now, Clerk?
Sure, I'm certainly content to address some of the issues that have been raised. I can give very clear answers on some of the issues. Some of the issues I might just need to get further clarification on. Okay. But certainly in relation to the stages of legislation, the bill is now past first stage. It'll be down to the business committee to schedule second stage. Now it can be, essentially it's up to the business committee to schedule that. So normal process would be that the committee would request a briefing from the proposer of the bill to allow the committee to speak at second stage and give it committee's view on the principles of the bill. But again, that'll be down to the committee to decide when to schedule that. In relation to the writing to the Human Rights Commission and requesting legal advice, the committee is entitled to request advice from any organisation that it wishes to, or request legal advice. Again, the issue of timing will be down to the committee to decide when's the best time to do that and to request that. And the same in relation to requesting a briefing from the proposer of the bill. It'll be down to the committee to decide the best timing around that.
Okay, thank you. Are members content with that as set out by the clerk? Go ahead, Jonathan.
Yeah, no, Chair. So can the committee clerk establish the fact that it is normally 4 weeks after introduction that the bill is given its second stage business committee pending? And if that is the case, have you ever seen a case where the private member is not offered the opportunity to discuss the general principles of the bill at the committee? Have you ever come across a situation where members of the committee would not allow that private member to brief the committee prior to receiving legal advice from a third-party organisation?
I'm happy.
Well, I think. Yeah. Go ahead, Clerk.
Sorry, Chair. In relation to timing of the second stage, yes, Jonathan, normally it usually around 4 weeks, but it is down to the business committee, and I know that there are a couple of bills there. So, for example, I think Jim Alistair's bill was about 6 to 8 weeks. The second stage was. I know that there's another bill sitting there that I think it's going on a number of months, and second stage still hasn't been scheduled by business committee, so it is purely down to business committee around the timing. As mentioned, best practice advice would be that you do get a briefing from the proposer of the bill that allows the committee to make comments in relation to the principles of the bill when it comes to second stage. But again, the timing of that will be down to the committee to decide on.
No,
okay. Well, in the interest of fairness, I think there is. If we're going to write off to anyone, I think we should also include any of the actions. I'm conscious that we have had a discussion, despite this coming in very late. So for me, it would be a matter of agreeing that if we're going to, if the committee agrees that we're going to write to HRC and to legal advice, we would also seek request a briefing from the proposer on the principles of the bill. So I think it's a question of timing in relation to we do it all next week or this week. We have a reasonably good discussion. I think maybe we could go ahead with each of those actions if members are content. So we request a briefing from the proposer of the bill. We write to the Human Rights Commission and we will seek the legal advice that the Speaker may have and may be willing to share. Go ahead, Paula.
Thank you, Chair. I really am not willing to, not wanting to engage with the sponsor of the bill until we actually have that information in front of us, because I'm not entirely convinced that it's competent and that we should be proceeding with it. After that occasion, I am more than happy for Mr. Given to come before us, but at the minute I am not satisfied that it is human rights compliant and that it would not amend the primary legislation, and I don't think that the Northern Ireland Assembly has the ability to repeal a primary piece of legislation from the sovereign Parliament.
Sure.
Okay, I'm going to go to the clerk first just in relation to that issue, then I'll go to Jonathan, then I have Pam, and I also have Alan. So in relation to the process that Paula's querying there, clerk, can you advise, please?
Certainly, I'm waiting just some further clarification from Bill Clerks in relation to the issue of competence and what is decided at first stage when the bill's introduced. So as soon as I get confirmation on that, I will advise members of that. And as I've said before, in relation to timing of briefings, it is at the committee's discretion, and it's for the committee to decide when's the best time to be briefed by the proposer of the bill.
Okay, thank you, Clerk. So we're going to go to Jonathan, then Pam, then Jerry.
Chair, firstly, I think the first part of your proposal is a very, very sensible approach, that we write to the bill sponsor to request that he comes before the committee to discuss the general principles. I think that's first and foremost a very, very competent way in which this committee should do its business. On the second part regarding the Human Rights Commission, I have absolutely no problem whatsoever. I have no doubt that the Human Rights Commission will have a part to play. They'll be before the committee, they'll have a part to play in relation to their views and comments around this. But I do not believe, and I would probably, in relation to that part of your proposal, I would like the clerk to give further information as to whether or not that is something that should be done prior to hearing the general principles, or whether that's custom and practice that happens. And on Paula's point, I can't believe really what I'm hearing. So the Speaker in his point of order to Paula suggested that this was within the legal competence of the Assembly, and I think it's extremely disingenuous that Paula would point out that she is not willing to hear from the bill's sponsor before she receives such advice. I think that's madness, given the fact that the Speaker has already ruled that it is within the competence. Let's take personalities out of this. Let's look at the bill as a whole in which it's representing itself. Members and other organisations will have many views on that, and they'll be given an opportunity to do so at detailed committee stage, where all members will have their views on the record. But I think it's an extremely dangerous road to go down, that we are blocking a private member from discussing the general principles of the bill before the second stage, therefore denying this committee the opportunity to fully engage with the bill as it goes through its process.
Pam, then Alan, then Jerry.
Thanks, Chair. And obviously I do support my colleague Jonathan Buckley's comments there. And I also very much welcome the introduction of this bill, as have hundreds of people who've contacted me over the last few days. Are also very welcoming of this introduction of this bill. I think in terms of Paula's point on the Speaker's ruling, I just think we need to be wary that we as a committee are not challenging the ruler of the Speaker. So Again, I think we would need the clerk to further advise us, because I don't think that would be in any way appropriate. So perhaps Kate could advise us further on that.
Okay, Alan?
That's exactly the point I was going to make, Chair, that Pam has just made, that certainly Paula is perfectly entitled to have an opinion on the competency of the bill. She's also entitled to, if she wishes to go down that road, to challenge the ruling of the Speaker. But I wouldn't be comfortable with the committee corporately being seen to challenge the Speaker's ruling at this point. So, there is a bit of a conundrum here.
Chair, can I come in quickly?
Jerry?
Sorry.
Yeah,
Sorry,
Chair.
no, I'm going to go to Jerry, Carol, then Carol, Nikhil, and then I'll come back to you then, Paula. Jerry?
Yeah, thanks, Chair. Yeah, listen, I obviously, don't support the bill. And obviously, if it's going to proceed, that I would like to sort of ask questions and challenge the proposer of it. But I think that kind of probably makes sense after we do get some clarity on the legal position of it. I not question the Speaker or anybody, but I think there's been some concern about this bill. So I think it would be important that before we proceed and before we question, that we just get a bit of clarity on that. That would be my preferred approach.
And Carol?
Yeah, I do think we need to get clarity. But the issue for me is, so first of all, I think I support the issue that Paul has raised in terms of getting Human Rights Commission in. So before we bring Paul Gibbon in, the other issue, rather than because it's going to go down a rabbit hole, in my opinion, about the competency of whatever, there's already a ruling on that. I would much prefer to get a legal opinion in about the issues that you raised regarding Westminster and that. I think, Paula, I'd be much more comfortable doing that. It's not because my colleague's a Speaker. It's just that I think it'll suck precious time and energy away that we need to focus on this bill being brought when the legislation was made in Westminster, given the fact that there was a denial of reproductive rights for women here. So,
Okay, I'm going to go to Paula, then quickly to Cara, and then I'm going to go back to the clerk for some more clarity in terms of competence. So I'm going to Cara Hunter. Go ahead, Cara.
I didn't indicate, Chair.
Sorry, okay, Cara, that's fine. Paula, go ahead.
Well, I'd just like to put on record apology to the Speaker. I wasn't trying to question his integrity, and that's why I would like the legal advice. So I retract that statement, but I would like to see the legal advice that he has been presented with that made the ruling that it was legally competent in the Assembly. Thank you.
Okay, thank you. So, Clerk, first of all, can you advise, is it in order for us to seek the legal advice that the Speaker has, and can you then provide some further clarity around the competence issue, please? Thank you,
Certainly, Chair. In relation to the process, before a bill is introduced, the Speaker will send it to the Assembly's legal services to consider competence. So the fact that it was introduced at first stage means that the Speaker was content that it was within the competence of the Assembly, and there is a statement on the cover of the bill to outline this. In relation to seeking a copy of the legal advice, certainly the committee can request it. Whether it'll be forthcoming or not, I couldn't comment.
Okay, thank you. Who's looking in now? I'm not going to draw this to a close now.
No,
But,
I just want to say, if that was, and I think if I'm reading right what Paul has said, and maybe Carol and yourself, if it is a request to ask the Speaker for the advice that he was given, I have no problem with that. I think I'm happy for the committee to do that. And also the original part of your opening proposal, which was that we also write to the private bill sponsor regarding our intention to hear from him before second stage. So if that was what was said, I'm more than happy with that proposal.
And we would also write to the Human Rights Commission, and I think members are indicating that they would like to hear from the Human Rights Commission prior to the sponsor of the bill, and I think Clerk is indicating that would be in order. Is that right, Clerk?
It's down to the committee to decide the order that it wishes to undertake business.
Yeah.
Okay, so are members content with that approach?
on that point, I don't know whether or not that is something that has been done before. I'm certainly not saying that we have to hear from the Human Rights Commission before the private bill sponsor would come before the committee. If that can be done, I don't think it should be a hold on holding back the potential for the private member to come before the committee, given the fact being, albeit, yes, it's down to the business committee, but if the second reading is within 4 weeks from whenever this was laid, this gives us in the region of just over 3 weeks. So it is important that we hear from the private member, Mr. Paul Given, in relation to this bill to inform us before second stage, because after second stage and goes to committee stage, the Human Rights Commission will have a central role in coming before the committee.
Okay. Now, the clerk has indicated that that's at the discretion of the business committee, that 4 weeks, that has been longer in recent times and could be longer. What I propose is that we take that course of action and we then next week decide in terms of scheduling. It will be up to the committee when we schedule in the various contributions. So I think if we do the 3 stages that we have indicated there, and next week then we can consider when we schedule those. That is down to the choice of the committee members. So we can have another discussion as to how we schedule that in, and indeed how we schedule in around all of the forward work programme that we have in front of us. So are members content with that approach? Yeah, okay. Okay, Claire, are you content that you have the instructions clearly enough?
Yes, sure, content.
Chair, can I just check? The legal advice that I would be seeking is around the human rights compliance. It's not necessarily, in terms of how you get from CEDAW to Westminster and the Supreme Court judgment to Westminster, and then the regulations are written. So I think that I just want to be clear about that. If the legal advice that we see coming back from the Speaker's office is not clear enough about that, I still would like to have the proposal on the table that we seek our own legal advice around human rights compliance. So I don't want that to be.
And we could come back to that, Paul, and we could, depending on what the legal advice is, or if we indeed get the legal advice, we can then make a full decision on any additional advice we would wish to seek. So we'll do that at a later point, based on what they're receiving.
Just on Paula's point there, I wouldn't be in agreement with what she is saying there. First of all, it's about the competence of the bill to allow then us to go through formality in relation to the private member giving his assessment of general principles. Paula's argument around the human rights compliance issue, that's going to be a crucial part of her argument at committee stage. So I think it would be very wrong for the committee to take a prejudiced opinion or legal advice before we even get to that stage.
Well, the committee can discuss and decide what it wishes to do when it comes to that point. Okay, members, I think we're content there that we have charted a way forward. So I'm moving on then to our forward work programme. Are members content to note the forward work programme as contained in your papers? Yep, members content. Any other business, members then? Do members have any other business? No indications on that, members. Thank you. Yeah, sure. Who am I hearing? Yeah, is that Carol?
Yes, it is. Just the issue was raised last week by Alan Chambers regarding the conversion therapy. I'm just wondering, was there an opportunity to go through the recordings of that? Because, there was some fairly heavy laden allegations made that were supported by Pam as well. So, and, in fairness of openness and social justice, I would like to see if there's any more response to that.
Okay. Well, Carol, that did arise in the minutes, and I know you were having difficulty at the start of the meeting getting on. I'll just indicate that. Let me get it here in the minutes. So, yeah. The minutes of the last meeting hadn't been agreed. They have been agreed now at today's meeting, but it is stated that Mr. Chambers raised an issue in relation to procedures. The clerk has confirmed that the procedure was correct and in order. Members were emailed out yesterday with the details, and the clerk had said that he would encourage members if they have queries on process and procedure that they discuss with the clerk at an early stage. So that was addressed during the minutes, Carol. Okay.
So thanks for that, Chair. Apologies, I couldn't get in to start. I just wanted to make sure it was covered.
Sure.
Okay, thank you. Jonathan, yes?
Two points. Number one was on the relation to the item of business today on the SL1, the addition of vitamins, minerals and other substance amendment. Just to notify the clerk, I do have some more technical questions that I would like to put through to you, and I will do so via email later today in relation to that. So it's just to put that on record. And the other one was, I think it was Carol mentioned earlier in relation to the regulations. I probably, like her, have had a lot of representation from those that are concerned regarding young people and the denial of sports, etc., to their mental well-being and physical well-being. It's something that I'm getting lobbied on quite heavily now. I don't know if other members are. And I would be interested to hear a deeper analysis and opinion from the department as to that adverse impact. And I would ask the committee's support in writing to the department to seek that.
Yeah, Clerk, are you clear enough on that? Are members agreed with that? And also, Clerk, can you advise those questions of Jonathan will be shared with the entire committee? Is that correct process?
Yep, Chair, I can certainly share that with the committee and then pass them on to the FSA to get a response on. In relation to the sport, young people and children in sport, we did have an item of correspondence last week, which we forwarded to the department for comment. So we are currently waiting a response on that, but we can certainly highlight that it was raised again today and get a response on that as quickly as we can.
Sure.
Okay. And having it, yes, Jerry, go ahead.
Just a separate point, Chair. I think the meeting this week with the victims and survivors was very, very important, and thanks to yourself and the team for putting it together. And I think obviously, it goes without saying, but I think we'll need to do a bit of work on the call and scrutinising the possible terms of reference for a public inquiry, which most and many of the victims and survivors want to see. So I just wanted to briefly mention that was a very important and worthwhile meeting.
Yeah, and just to remind members once again that we are due to be briefed by the department on this issue when those questions can be raised on the 11th of March. So we have a forthcoming opportunity. I just wanted, Alan, there's a hand raised there for you, Alan.
Yeah. Yes, Chairman, just in relation to that, it was a very harrowing session to listen to those victims, and I'm sure they're only a flavour of the stories that must be out there. But I know one of the gentlemen was saying that it was important that the victims helped to shape the public inquiry, and I know that some people were sort of wanting a public inquiry to start tomorrow, but I think that they're going to take 3 4 months, 6 months maybe to formulate how to go forward, and I think that is to facilitate the victims helping to create the model of the public inquiry, and I think that's absolutely essential. I don't think we can go into a public inquiry that the victims don't fully buy into and fully support. I think that's very important. But just a small logistical problem. I had great difficulty, Chair, and I think maybe you had yourself, actually getting into the meeting. I struggled for about 15 or 20 minutes, and I don't know how I actually have finally managed to get in, and I think I might only have got in on audio, but it's maybe a different system. It wasn't a Zoom or it wasn't Starlight, so it's maybe we might need to get some technical advice if we're going to go into a meeting where that system's going to be used in the future. But sir, I don't know whether any other members had any problems, but I certainly struggled with it.
Yeah, and I think that is so that meeting specifically was organised and arranged through the offices of Judith Gillespie, and that was the system they came up with. It did create some difficulties. We have indicated that we see that as a process of ongoing engagement, and we will look at different ways of doing engagements so as we have different voices as well. I agree with both of you. I think it's absolutely essential that the victims are central to the shaping, the formulation, the direction of any public inquiry, and I think that came across loud and clear, and I would agree with you. That is, and there does, I'll come to you in a second, Carol, there does need to be, I think, support provided to those families so they can engage in that process on the basis of fairness and equality, and to use the legal term equality of arms, so that they're going in there equipped with the information and the knowledge and are engaged with in a way that allows them to input. Carol.
No, I agree. I wasn't at the meeting, but fair play to you. It sounds like a very powerful testimony. Chair, I just want to raise the issue around the way in which the department have conducted a high-level equality screening rather than a full equality impact assessment, even given their own evidence last week. It's very, very clear there's going to be detrimental impacts on children and young people, older people, and I for the life of me just cannot accept the way in which they've conducted this. I just believe that they're undermining their own argument for additional funds to go to the right places. So I just want to put that in the record. I would like even just if we could write just a bit more of an explanation as why they chose that course.
Members content with that we would seek further information from the department around their decision-making process around the equality and the screening process of it? Yeah, members are content. I just want to check with you, Ciara. Were you indicating there at one point in time, or are you okay? Ciara Hunter? You're okay. Okay, members. Thank you for that. I think that's probably everything then that we need to deal with today. I'd like to thank you for your attendance and your attention. The date, time and place of this meeting, members, our next meeting will be on Thursday, 25th of February at 9:30 a.m. via video link. Thank you, members. Take care. Slán go fóill.
Thank you, Chair.
Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed.